All right, I would like to call to order this regular meeting of the Boulder Valley School District Board of Education for Tuesday, January 12th, 2021, our first meeting of the new year. Happy New Year, and I'm glad you can all join us. Laura, could you please call the roll?
Certainly. Garcia.
Here.
Gebhardt.
Here.
Marquis.
Here.
Myers.
Here.
Sargent.
Here.
Sweeney Moran.
Here.
This.
Here.
Thank you.
Okay, please join us in the Pledge of Allegiance. The allegiance to the flag
To the
of the United States of America,
and to the Republic,
for which it stands,
one nation, under God, indivisible.
with liberty and justice for all. Okay. I'd like to remind everybody that the mission of the Boulder Valley School District is to create challenging, meaningful, and engaging learning opportunities so that all children thrive and are prepared for successful, civically engaged lives. So yeah, thanks again for joining us tonight, and we'll go right to our Superintendent's Report, which is going to be combined with the COVID update.
Thank you, Board President Marquis, board members. I believe Randy is pulling up the deck. Before I get going, happy 2021, not only to the board, but to the public who's tuning in. We've had a great start to the school year. I had the opportunity to head out to several of our schools today, Broomfield Heights Middle and Angevine Middle. Just a special thanks to all of our teachers, educators, leaders, and staff that are making this work and work well. Kids were beyond excited to be in school, and so it's just a really great way for me to start my day, and just as a reminder of how important having kids in school is, and so all the effort that I know that we're putting into not only return to in-person learning, but to make sure that we're able to maintain in-person learning is certainly appreciated. Board members, there's a couple of pieces of data that came out today that I'm excited to share with you all in regards to graduation rate. If we could get to the next slide, Randy. So as you all may have seen, graduation rates for the state were released today. Our graduation rate in the Boulder Valley School District went up slightly, 0.3 percentage points. But we did see some increases for several student groups that I think is great signs of progress for our school district. Black students, our graduation rate rose 11.8%. Students with disabilities, 5.3%. Our limited English proficiency students, 4.8%. Economically disadvantaged, 2.7%, and Title I, 7.9%. And so I think that is fantastic news as we think about making sure that we're taking care of all of our kids and that they're graduating in the Boulder Valley School District within 4 years. This is the 4-year graduation rate. Randy, next slide. In addition to graduation rates, dropout rates were released today as well. In 2019, we had 123 dropouts, which is 0.8%. And then we look at 2020, amidst a pandemic, that we were able to actually cut that number almost in half. And so less students dropping out, more students engaged, more students graduating. I think that those are all great signs of things working very well in our school district. Very excited to be able to share that with you all and with the public. Again, the data for the entire state was released today, and so I wanted to share that. And we don't have a slide on this, but I know board members that I've shared this with you before the break, that we also received really good news in regards to our industry certification completers. We actually doubled the number of students who earned industry certifications through our CTE programs last school year, up to 440-ish, I believe. I don't know the exact number, but also another leading indicator that some of the work that we're doing and some of the emphasis on not only CTE, but making sure that kids are graduating and supporting that those things are working very well. So I wanted to share that good news as we get started with tonight's presentation. And so the second part of the superintendent's report is a COVID update. And so Randy, if you'll pull that slide deck up for us. And I believe that I'll be turning this over to Jeff Zyak from Boulder County Public Health. And I don't believe Jason Balling's with us. I believe it's Helene from Broomfield, City and County Broomfield Health to present tonight. So at this point, I will make sure I see Jeff. I'm going to turn it over to Jeff. Thanks, Jeff, for being here tonight.
Absolutely. Congratulations on the great news relative to your dropout and graduation rates, too. That's awesome news. Board members, thank you for having me back again. Our plan tonight is to go through a quick update on the data and show you where we are at this point, which is looking more and more like it's positive news. To talk to you about vaccinations as well. I know that's on a lot of folks' mind right now. So Chris Campbell, who is our emergency manager and response coordinator and is in charge of our vaccine distribution, is on the phone with us as well. And there's several other team members of mine as well that are on the phone to answer questions tonight. So Randy, do you want me to share my slides, or are you going to run those? Thank you. So we can go to that second slide. And my plan is to just go through again and quickly show you where we are at a statewide level. I am having a tiny, there you go. Thanks. If you can make that a little bigger. Thank you. Okay. This is the dial information, again, that I've presented to you pretty much every week. You can see that we have 1 out of 3 indicators that are still in the red. The other indicators are below red, and we are just above the red. So last week, that incidence rate, which is that first indicator, was around 360. It got up as high as 380 per 100,000 for a 2-week period. It is starting to drop again. So you'll see this trend as I show you the other data that we're going to go through. Next slide. And we're getting there. Can you go a little bit? Yep. Randy, do you want me to share my screen? It might be easier.
Yes, if you don't mind. It's acting up on my side. My apologies.
Yeah, not a problem at all. I'll share it. Hold on. Let me know when you can see that.
We can see you.
Great. So this is the Metro data that I've showed you, and you can see what we have experienced, which is this slight bump that you're seeing right now. If I showed you the data that I just received this afternoon, all of these would be on the decline. I just didn't have time to update it. But what we've seen is a bump that was associated primarily with Christmas and New Year's, and our mobility data that we looked at the statewide level confirms this, that comparative to Thanksgiving, we did have more mobility associated with Christmas and New Year's than we did comparative to Thanksgiving. But our hope is that this will be the extent of the bump. And you can start to see some of it here. And again, if I had the updated slide today, you'd be able to see this more pronounced. And I'll talk about it a little bit more. Here's our cases, our 5-day average number of cases. Again, this is the little bump that we hope is the top of it, and it's going down. And the time frame that we're looking at, just as a reminder for everyone, is about 14 to 15 days after New Year's. So we're 12 days now. And the reason we look all the way out to 15 is because most people show symptoms 5 to 7 days. And then somebody could still be incubating the disease up to 14 days, although that's not as usual as the 5 to 7 days. But then it takes time for people to get tested, for those reporting results to come back to us. So really 15 days is about the time frame we would expect to see the full picture. Again, I'm hopeful that this is the full picture and that we'll continue to see cases decreasing, but the next few days will tell that for sure for us. This is our case rates by age group, or 2-week incidence rates, I'm sorry, by age group. And you can see that we are pretty stable across the board here. And then just, again, I've talked to you about this data the last time I presented, but this is our 0 to 9 that's on the bottom here. And this is our 10 to 17-year-olds that's on the orange line here that you can see. So you can see that our 10 to 17 and our 0 to 9, although our 10 to 17 is bumped up a little bit, these are both staying relatively low and stable at this point. This is our positivity rate. It's remained below 5% for the most part since about this time frame right in here. And that's good. That's what we want. That means we're doing an adequate number of tests in our county. We have completely adequate testing in Boulder County. Encourage everybody that's listening, please, especially after the holidays, to go get tested. If you just go to Boulder County Public Health, COVID Data 19, click on the testing link. It'll take you to the location of the sites, the hours they're operated, and it'll tell you which sites are free and accessible. It doesn't have to be for people who just have symptoms. So please take a look at that and take advantage of our testing. This is our hospitalizations, which are on the downtrend in Boulder County. This is great. Typically, as I've shared before, when we see case increases like this, we see a delayed lag, and then we see hospitalizations, and then we would see deaths. And we are starting to see a decline in hospitalizations. That is good news. We want that to obviously continue. This is our deaths. You're also seeing a decline in deaths here, and that is consistent with what we were seeing in the decline in hospitalizations. This is the third lagging indicator that typically happens, is our deaths, and these are obviously the ones that have the greatest impact on families, parents, fathers, brothers, mothers, grandparents. It's just tragic that we have seen so many deaths associated with this disease in Boulder County. But the good news right now is that we're on the decline, and we are getting our vaccinations out into the community, as Chris will talk about here in just a second. We've also been spending a fair amount of time on sports guidance. So the Colorado, I'm sorry, I can't remember what CHASA stands for, and I think no, that is the correct acronym, but I can't remember what it stands for. But regardless, it's sports guidance that has come from the state level. That has included the Colorado Department of Public Health and Environment on that guidance. And what we've been looking at is how does that guidance relate to what's going on across our counties. As you all know, Boulder County has a masking order that is in place that is more restrictive than the states. We've had it for some time now. There's also two other counties, Denver and Jefferson County, that also had masking orders that are more restrictive than the states. So we've been working to try to figure out how do we deal with some of the guidance that's come out and still protect our kids who are participating in sports from spreading the disease, with the intention of trying to make sure that these sports can go forward. We all know how important sports are in terms of physical, mental health, social well-being, and certainly all of our kids also are very well aware of that. I've received a lot of emails in the last couple of weeks about this. So we, as a Metro Denver Partnership for Health, this is a group of public health directors across the metro area, came up with recommendations that we have now sent to the Colorado Department of Public Health and Environment, to CHASA, and to the Colorado Department of Education, as well as our school districts, and made 4 main recommendations that would allow these sports to go forward and still be protective of spreading disease within the schools. Again, focusing on trying to keep kids in school to the maximum extent possible. And the 4 recommendations encompass mask recommendations. This was especially an issue for wrestling. There are some masks that are being used by other states that are different than the masks that we all have been using, and they can be used for wrestling. So that was one of the recommendations. The second one is to have kids who are wrestling to do remote schooling, so that if they are exposed during a match, that they're not coming back and potentially bringing that back into the school setting. To delay the season is another recommendation that was made. And finally, testing was the last recommendation that was made. And I think Rob is going to talk more about this at the end. So here I'm going to turn it over to Chris Campbell, and he is going to talk about where we are with immunizations. We've also had a ton of questions on this. One of the things I want to say right up front to folks that are listening in is that CDPHE mandates how we follow the vaccination requirements. They are really clear that we need to be following the guidelines that are in place. As you all know, the governor sets those guidelines in conjunction with CDPHE, and those guidelines get communicated out through the governor's office. they have made it very clear to us that we need to follow the guidance that's in place, or we could lose our provider's license. And that actually goes for everyone that's a registered provider of providing this vaccine in the state of Colorado, which is why there was so much confusion at one point right after vaccination started to occur, with teachers looking like they were going to be vaccinated. And the intention of vaccinating that 1A and 1B above the line is because that's where 78% of the deaths are occurring in the state. We know if we can get the vaccine out to that highest risk population, we're going to make a significant difference in terms of deaths and hospitalizations in our state. And that's why the state has prioritized that as the highest category. But Chris will talk more about that, and I'll stop there and turn it over to him. And Chris, just tell me when you want to advance the slide and I'll do that for you.
Will do, Jeff. Good evening, board members and Superintendent Anderson. My name is Chris Campbell. I'm Emergency Management Coordinator with Boulder County Public Health and our vaccination lead. I first want to say I have boys in 3rd grade and 1st grade at Community Montessori, and I just wanted to thank this group for their leadership throughout these really challenging times. So it's an honor to be able to present to you this evening. Just do a quick high-level overview of where we're generally at with getting vaccines out in the state of Colorado and then in the Boulder County community. These numbers actually have gone up since yesterday. So we've, in the state of Colorado, vaccinated about 200,000 people with 1 dose and about 40,000 people with that 2nd dose, which is really important and encouraging as we start to move towards a sense of normalcy and seeing the impacts of vaccines in our community. Next slide there, Jeff. And I did want to mention, I think this slide might have gotten left out of our deck, but in Boulder County, we have vaccinated just over about 10,200 folks with their 1st dose in the county, and we're really moving into that 2nd dose group as well, so about 1,700 people in the county with their 2nd dose. So it's a start, and we're starting to make progress. I just want to point out to the board a couple of things. We are in our 5th week of this vaccination endeavor, and so we are diligently moving through and really working hard to vaccinate community members, and we're really ramping up and starting to make some good progress. And I just wanted to talk about a few things with the statewide plan with this slide. So again, we're diligently moving through those first phases. You see there 1A, which again, as Jeff mentioned, is really folks working very closely with community members that might have COVID, healthcare workers. Our hospitals have done an incredible job of working with us and vaccinating community members here. We're likewise starting to work and vaccinate first responders in the community, other healthcare providers like dentists and pharmacists. Making good progress there. I do want to mention we still have about 5,000 community members in that group that we're still working to vaccinate. And additionally, as you see, that group that was recently added, the 70 and older group, that's about 30,000 community members in our county. So, it's going to take a little time to provide vaccine to these community members. And I'll talk a little bit about what we're looking at with the vaccine allocation in the state. Next slide there, Jeff. This is a slide that early on we started discussing vaccination administration in the county. It was really important to keep in mind as the vaccines are being rolled out, we knew there was going to be a time of very limited availability of vaccines. It just simply wasn't going to be enough vaccines to vaccinate every community member in Boulder County. And we're in that right now. So just for the board to understand, and we are, the state right now is getting about 60,000 doses allocated to them, the state of Colorado, on a weekly basis. 20,000 of those doses currently are going to the pharmacy partnership, and that is vaccinating long-term care facilities and staff and residents in those facilities. That partnership is thankfully gaining momentum and started out a little slow. We have 40 plus long-term care and assisted living, skilled nursing facilities in our county. and it's very important those community members certainly get access to vaccine. And so that is rolling out. But if you do the numbers, that leaves about 40,000 doses allocated to the state of Colorado on a weekly basis currently. So we are very much in a constrained environment, and it's going to take a little time until that starts to ramp up and the community has more access to vaccine. I am excited to say that in our work, we have 27 enrolled providers in Boulder County. So this is all the hospitals, this is the University of Colorado, the federally qualified health centers in the county, Clinical and Salud. We've partnered with Safeway and King Soopers, the pharmacies there, along with Boulder County Public Health. We really do have a good capacity in the county to get vaccine out. We're just ready to get more vaccine. So we're in a good place, and we're excited to keep moving ahead. Next slide, Jeff. I did want to mention just some of the things we're doing with our planning. So we are really looking at implementation to the next phases. So as we move on to those areas below the dotted line on this graphic as part of the statewide plan, this is where frontline essential workers are crucial to identify and start working with. These are workers in education, manufacturing, public transit, and we are doing that planning right now to be prepared to scale up and meet the needs there. It's going to be a challenge there, and we're ready to take that on. And I do want to mention additionally that health equity really does do all of the health equity frames all of our planning, and I think it's important to recognize. We have hired a cultural broker to really work with us and ensure that we are removing barriers, ensuring access to all community members when the vaccine is available. So we're excited to continue to work through that. Next slide, Jeff. I did mention this maybe back one.
Sorry, too far.
Okay. So we are Boulder County Public Health additionally is running clinics, and we're looking to increase that capacity. We've really landed on a good rhythm and understanding of what it takes to move to really provide vaccine to community members, and we're looking to really scale it up. So we're looking to increase that capacity across the county. And we're also continuing to develop, to look at developments in vaccine allocation. So you might have heard that there might be some additional vaccine candidates come on board under emergency use authorization, like the Johnson & Johnson vaccine. That is simply going to provide more and more vaccine to the community. And we are looking at all options and all kind of structures, including what maybe larger scale mass vaccination clinics in the county to really allow access across the board. Also providing and looking at more accessible, so if we do need to go and do mobile vaccination clinics, we're looking with partners there. We have a great partnership with Boulder Community Health, which is doing on-site and mobile testing, and that's a partnership we're looking to leverage here to meet all the needs of the community. Next slide there, Jeff. And I just want to remind the community members, we have a sign up so that you can put some information in, and we will send a notification to you when vaccine is available to you as a community member. We have this in both English and Spanish on our website. We really encourage community members to sign up there. With the same, I would just mention to also acknowledge or just be a little patient. It's going to take a little while as we move into these other phases, and just the sheer numbers of folks who need to be vaccinated. Might be a little while before you hear from us, but we're going to continue to use every forum we can to communicate with the community. We'll have press releases out. We will communicate in every way possible these types of forums with the board and to share information with community members. Go ahead, Jeff. And just a message to leave the group with. So, we see some light at the end of the tunnel, and we really are, still in a tough place in terms of the spread of the disease in the community. So we just encourage folks to really continue to do the things we know that work. including no large social gatherings, really keeping your distance, masking, washing your hands. We'd also encourage community members to go to the Add Your Phone site and add your phone. This will send you a notification if you were potentially near a close exposure, and that could potentially help stop the spread of the disease in our community. So just want to end with that message that, again, it's very positive, and we're excited to be able to roll vaccine out. It's an unprecedented mass vaccination campaign. It's been a really tough year, and we need the community to continue to be diligent. So we want to keep that message out there. And be happy to answer any questions, or Jeff, if there's anything on this, please add to that.
I just want to make sure Helene, I believe, is online with us from Broomfield. And Helene, I would love it if you could offer any insight relative to any of this from Broomfield, or anything else that you want to make sure you're getting across to folks on the board.
Sure, and I have my own slides to kind of just add as well, so I can share my screen if that works for now, and I'll add in some of the same things, some of the same information. All right, can you guys see my screen? Yeah, okay. All right, so thanks for having us, and Happy New Year, and it's nice to get reconnected with our school partners again and everybody. So just to kind of, I'll try to summarize a lot of these things as well too, since we've kind of hit on them. But our positivity rate, we continue to watch that, and we're all being kind of cautious of if we see any concerns from the holidays and, you know, travel and just different things. So we've seen a little bit of an uptick. We're happy that our positivity rate is back in the 5s, but we are kind of cautiously watching as we've seen it go up just a little bit. Similar with our cases, our case incidence per 100,000. So we've seen it's kind of been hovering around that 340s, 350. So we're just continuing to watch where that goes as Jeff already shared, we kind of are careful for about 14 days after exposures in terms of how our numbers may change. And just looking at that state 7-day average, also just similar in terms of just a little bit more of an uptick. So keeping, you know, that in mind, and just kind of comparing that to where we felt like there was this really big increase that continued through November. And hopefully this is more of just a slower, steady increase versus a big spike again. We are encouraged to see less hospitalizations in general, so we're hopeful that that continues to help kind of set the stage for what the state is dealing with. Just some highlights of some of what we see as our epi trends or epidemiology trends. As we shared, we've been kind of watching that positivity rate kind of increasing both in Broomfield County as well as in the state since 12/27, kind of after Christmas. The incidence rate has been increasing as well, and so Broomfield County, we've seen that kind of continuous growth over the last 8 days or so. And we know that holiday component can be part of it. I know a lot of the conversations and questions have also been about the variant and what part that will play. And there's a lot of things we don't know still, but it is very much on everyone's awareness. The state lab is continuously monitoring in terms of looking for if there is a variant identified. Everything in COVID changes rapidly, but as the last I knew, we had 4 confirmed and 2 suspected. So we definitely know that it's in the state, and we'll be continuing to monitor for that. But we are happy to hear that while it is very contagious, we're not hearing that it being any more deadly or any other concerns. And right now, there's the expectation that the vaccine is still going to help with that variant. So we will continue to watch that. Much more to come from that. And just unclear to know yet, will this kind of be a new surge? Will this be just kind of a short-term increase? So as Jeff already shared as well, please seek out testing. We still have our testing ongoing weekly in Broomfield County, as well as resources. The link that will be shared that has information on other COVID testing and information. And then just to also speak to the vaccines, because we're also, we work really closely with Boulder County Public Health, and we've also been working with the Boulder Valley nursing team, BVSD nursing team, just to kind of give a perspective of just how massive this is. This slide, I know, has a lot of numbers on it, but if you can just kind of look at the phase 1A, so our highest risk healthcare workers, these are estimates of numbers that the state has put together, and then our long-term care residents, which we know is where we've had such a significant amount of the deaths. How many people, residents and staff, and so we're total phase 1A, we're ballparking around 187,000 people. Then when we add in the phase 1B, and we're looking at that moderate risk healthcare worker and other first responders, and we add in our population of 70 and older, and that's excluding the skilled nursing that we've already captured, and other frontline essential workers, we're easily at over 1.3 million. And so then for comparison, on the right side is kind of where we're at with vaccine coming in. And so we're very excited about the vaccine. We're very hopeful about the vaccine, but it is going to be a lengthy rollout. And so we are only a few weeks into this journey, and this is going to be many months. But just to give perspective of as of the end of last week, looking at about 282,000 doses, and as of the beginning of this week, looking about 217,000 doses of vaccine have been administered. There's data upload and reporting, so some of that numbers probably is a delay in reporting, but we have still a need for over 1.2 million more doses just for phase 1A and 1B. And I know that's hard to hear, and we really want to focus on making sure that we do start the conversations of getting teachers vaccinated and all the other families and other individuals that will fall into phase 2. But we just are trying to just set that understanding that the vaccine is so very limited, and there are a lot of people that we have to prioritize just in terms of just the availability of vaccine stock that we get. And then to just share a little bit more of the state's current plan, which this will continue to evolve as well as we start to get more vaccine coming into the state and more vaccine manufacturers on board, really recognizing that 70 and older group is really our highest death rate, and so we really want to make sure we're getting all of our 70+ population vaccinated. So it's a combined partnership with the hospitals helping and pharmacies helping in an expanded role that they've never helped before, the local health departments and community partners and our federal qualified centers. So it's quite it takes a village in terms of as we keep kind of vaccinating the whole state. This is just another visual to kind of show what this distribution chart looks like. And again, just kind of highlighting the extremely limited stock that we're talking about that's coming in. But a lot of the healthcare workers in 1A, it's been primarily through hospital channels with some partnerships from some of the health departments, LPHAs, that's what that stands for, and pharmacies, and the long-term care facilities, the skilled nursing facilities, assisted living facilities, a federal partnership with CVS and Walgreens, and thankfully we're happy to report that a lot of them have already been scheduled and started getting their vaccine, so that's great to hear. Same with our first responders, they're getting a lot of their vaccinations through the hospital partners, and as we continue rolling on this phase 1B, when we look at the other healthcare workers with direct patient contact, we're utilizing our pharmacy partners, and then 70+ is going to also utilize those pharmacy partners, the health departments, the smaller outreach clinics, as well as the hospitals reaching out with their healthcare providers, contacting their patients with a portal, with a way to link and sign up. And all of this is going to take time. And so we just ask for everybody's patience. We know it's frustrating. We know there's a lot still to go through. And this is just, again, trying to show a visual of what it looks like in Broomfield in terms of our vaccine update, and a lot of these will be in progress for quite a while. We're still finding, just like Boulder County, that there are still 1A healthcare providers that we need to make sure they get taken care of. And we are we're starting to roll out with our 70+ population, and we are having those coordination meetings and planning meetings with our school districts to be ready to go as soon as we have that additional allocations and vaccines, which again is probably looking at the end of February, beginning of March, just to kind of put context of that timeline. And just in terms of awareness, we have a dashboard, a vaccine dashboard that is on our website as well. And just to highlight, we're looking at about 3,100 Broomfield residents that have received the vaccine so far, and about 800 of those are 70+. And within about a week, we had doubled those numbers. So these are really small numbers when our total population of 70+ is about 10,000. So we've got a long way to go, but we're excited about getting that into information on our website. And I think, I know this is not as relevant to the school audience, but I just thought it was interesting to just share and highlight the back to business we are all hopeful for this new year, and we want to help support our restaurants and our businesses and gyms. And so Broomfield County is participating in the Back to Business in terms of helping to promote businesses that do follow and practice all of the things that Chris already highlighted and things we know work: masks and distancing and cleaning and all of this, screening employees. So these businesses will be listed on our website, and then because of all the implementations that they have, they get to operate in a yellow capacity on the dial. So that's another good thing to look forward to, and hopefully helping with the economy. And then this is just our general information on broomfield.org. And so again, thank you guys, and we're happy to answer questions and fill in more.
Rob?
Yes, thanks, Tina. Thanks to Jeff and to Helene. Before we stop to answer questions, Tina, I would ask if you want to do that right now. Just to reiterate in regards to what Jeff had shared regarding wrestling, I do know that we've had lots of community input and feedback on wrestling. We are going to adopt the recommendations from the Metro Denver Health Partnership, and we will be moving forward with Season B with wrestling. Athletic directors or principals will be sending out notifications to student athletes tonight. We will be asking students to, while they're competing in Boulder County, to wear masks, and we've been working with our athletic directors to be able to procure the masks that have been recommended that are safe to wrestle in. We will also be asking those students to participate in synchronous learning, so not coming to school in person, but being more remote. We do not, at this point, feel that CHSAA is in a position that they are going to move the wrestling season back, which we felt like would have been a good step. But we want to make sure that by implementing these measures that have been recommended by the health experts and our partners, that we'll be able to move forward with wrestling. And then finally, we're going to be recommending a testing schedule. We'll hear a little bit more as we start. Our staff presents our COVID update in regards to the enhanced testing that we'll have available for student athletes and community members and our employees. And so I just wanted to be on record to share that is going to happen. We'll be sending that communication out this evening. So Tina, do you want to move forward with questions now, or do you want our staff to move forward with our COVID update and then ask questions?
Let's ask questions now related to the health data. So board members, Richard, and then Kitty, then Lisa.
I just want to thank both health departments for the presentation. The question that I have is for Rob, and it's really on the dropout and the graduation rates. You did mention that it's gone up and it's gone down in terms of dropouts. But is it desegregated in terms of how many Latino dropout numbers we have and how many Latino graduation numbers do we have?
Yes, so we'll make sure that we get that to the board again. That data was just unembargoed today, and so we'll make sure that we get that information to you all. All signals point to that we're seeing really good progress with the subgroups that we shared, but we'll get the board a full and complete report on that.
Okay, Kitty?
Yes, my question is for Chris. And the chart you had with the rollout of availability, does that reflect what the incoming Biden administration has said they're going to do, or does that reflect the way vaccines are available now?
Thank you. That's a great question. Things have been so fluid. That is an older slide, and I still think it's very. I think it does illustrate what we still need to plan for and anticipate, that there is going to be additional vaccine available to the community. It is going to ramp up, or ultimately we'll have vaccine for every community member that would like access to it should they choose to get vaccinated. So there's certainly some information that we get really on a daily basis about if we're going to get additional vaccine and when. And again, I think our goal in Boulder County and the community is to make sure that we have all the structures in place to and be ready to go when vaccine arrives.
And then I have a second question on the vaccine. So if we sign up to be notified, and when we get a notification, then do we just go to our own healthcare provider for that vaccine, or do we do something else?
Yeah, I think that's a great question. The notification will ideally give you those options for you. So again, it's going to be an all hands on deck approach, as you've heard. Potentially folks will be accessing through a hospital partnership. We might direct some folks with a link to a pharmacy, a local pharmacy. Again, we're exploring and really think it would behoove us to set up larger scale points of dispensing or vaccine clinics in the county. And so I think there will be instructions on your options when the vaccine is available to you. There should be lots of options.
Okay, thank you.
Hey, Lisa.
Thank you so much to our county health folks. When we get to those essential worker groups, are folks going to have to present some sort of proof of eligibility? And if so, is that anything from letterhead to ID, or is there going to be a standardized form that employers need to be presenting to their employees?
Another great question. And, we have some tools now we're using that essentially just ask some questions and then let you know if you're eligible. I think as we start to get into those groups and we've seen the sheer numbers, we don't want to provide any barriers. So I think we talked with the providers in the county, and from public health, for example, we're not asking a whole lot of questions. The point is really to vaccinate as many community members as possible, and we're asking folks to wait their turn. And we know that folks will slip through and potentially get vaccinated, and that's okay. I do think some of the other partners we're working with are asking a few more questions, and we're okay with that. And again, our overarching goal is to remove barriers. So that is a very large group, and I think we need some additional information from the state on what those categories are so that we can dig into that. For example, we really want to engage with, we've already engaged with the school districts, but engage with large companies to understand their employees and ask them if there's limited vaccine, who should access vaccine now and maybe can wait a little bit longer, and work with employers on that as well. So lots of strategies we're discussing currently.
If I could add a little bit. Go ahead.
If I could just add too, for our education partners who fall into that 1B above the line designation, they will receive a letter on letterhead from the school district, and will need to bring photo ID to the clinics that are set up for those folks, just to ensure, hopefully, that people aren't getting through when it's not necessarily their turn. But that's not typical in sort of our general setting, but that's something that we've agreed to do to help streamline some of the process of our education staff.
And that looks similar for Broomfield County. We are trying to be very careful and strict about any information or link that's shared, because there is such limited vaccine, but we don't want it to be a deterrent in any way. So whether that's a work badge or something, there's definitely ways to make that happen. And I'm not sure if we said this before, but there is no cost to anyone. So whether they have insurance or not, no one would be turned away, and there should be no fees at all. And the hope is each week that there will be more and more vaccine coming to the state and allocated to each county. So hopefully these numbers will move quicker. But right now we're just kind of at the mercy of the amount of vaccine that we get.
Okay. Other questions? Donna, and then Kathy, and then back to Kitty.
Okay, a couple of quick questions. And one is, I wanted to thank Rob for addressing the wrestling situation. We received so many communication about that, and I'm glad we found a way to allow wrestling due to the social and emotional impacts it has on our students. But back to the questions I have on vaccinations. A couple of staff members and teachers have asked me, if they're on the precipice of 70, let's say they turned 70 in April or May, would they move up on the chain to be vaccinated or the list? That was one question. Should I go on with the second one? Or
I can
answer
that quickly. We're expecting, actually, just today, I think at the federal level, they were talking about the number potentially moving down to 65. So that may catch that group of people anyway. But we definitely are being mindful if somebody's like right on the bubble of turning 70, and we are trying to get those conversations already going with the school district partners to identify any employees that are 70 and over, because again of that, knowing that higher risk group and being present in school. So we are trying to mobilize them getting vaccine now.
Thank you. Perfect answer, because I know a couple of that have contacted me. They're already scheduled in 2 weeks for their vaccination because they're 70, but there's a few that are saying, but my birthday's April, my birthday's May. So that helps because they're watching, and I said I would ask the question. The other question I have from constituents is, can anybody answer exactly what more contagious means? Does that, and there's several little bullets I have on, does more contagious mean less amount of contact? It gets through a mask easier? I could go on and on. It lives on places easier. It stays in the air. So the question was, can we address more contagious?
Sure, I could be happy to answer that one, Donna. It's all of the above, and I think no one at this point, because these studies are epidemiologic in nature, looking at large populations, they notice an increase in rate of spread within the community. So all the research that's going on is looking at how that is spread, and it's likely to probably be more viral load, or might attach to the cells or the respiratory membranes a little close. But we don't know that answer, and I can't remember if it was Campbell or Helene that mentioned this. We're learning more about this virus as we go along, so it's hard to say that's exactly right. But the important message is this: is all the prevention strategies that we are doing now can prevent this new variant from spreading. So it's not if you do wear a mask, you do physically distancing, if you do all the things that Rob and his team have put together to help our kids be safer in our schools, that's going to protect us from whatever variant that comes about. And the other thing that Helene mentioned in her slides, which I think is worth repeating, which was at this point we don't think it's going to cause more severe or deadly disease. And we also think that this vaccine or the vaccines that we have in development are also protective against the new variants that have been developed. And finally, the treatments that are being developed to treat people who have COVID-19 are also effective against these variants.
Thank you. You answered that so well, because people are listening. I think their big concern was, do the desks need to be further apart? Do the masks need to be more up to date? Anyway, but you answered it. Sometimes we don't know everything, but thank you.
Okay, Kathy?
You may or may not be able to answer this, but I'm just curious if you know how it is the state's determining who gets what allocations, because of course people talk across county lines and across district lines, and you hear all sorts of different stories, and I'm just wondering if there's some message that's a common message that we could use to try to help ease some of the concerns, that there is a method to what appears to be some madness right now.
We can certainly weigh in here. I'll give my thoughts just briefly. So I think initially when the vaccine first started rolling out, it was very limited, and the state made some decisions around allocating vaccines to more rural counties. And if they would have just simply gone by population, a lot of the vaccine just would have ended up in the population centers in the state, and some of the rural counties would have gotten zero vaccine. So that did impact the initial allocation decisions, and that's why we saw maybe more limited vaccine in the Front Range area, the larger areas. Since then, and Helene maybe you can speak to this, the state is still making decisions on the allocations, and Again, I think it's based on a number of factors. The Moderna vaccine came on board, and I think they're getting an understanding of really the providers that have capacity to get vaccine out, so the capacity of hospitals. Really, ultimately, they're getting to a point where that will be turned over to potentially the counties to have a bigger say in what kind of vaccine requests they have and see if they can fill those. So for example, if we have a vaccine clinic set up to work with a certain group, and we know we need this many doses, we can put that request into the state. That mechanism isn't being used yet. It's really the state is just making the decision to distribute vaccine out and push it out to the county. So I hope that answers the question. I haven't heard really a methodology, a clear methodology yet, other than that initial phase and how that rolled out, and then some decisions being made at the state level based on capacity of providers to get the vaccine out.
And maybe, Tina, this is something when Rob presents, I'm just curious where we are on this home delivery of home testing, and how do the people at the county health departments have a high level of confidence that these tests are reliable, and kind of where are we in that whole distribution of getting the tests out to homes to actually be able to use those?
Dr. Bean, if you want to talk to the reliability, I know the districts are starting to just get that information compiled. I have not heard an update yet from where BVSD is at, but I know the other districts that we work with as well, we have every confidence in the testing, and it'll be a nice opportunity because it will be shipped. It has the ability to be shipped directly to, for example, to a teacher's house, and what we call surveillance testing. So potentially like a weekly testing to make sure, catch if someone's, either asymptomatic, has no symptoms, maybe pre-symptomatic, starting to not feel good, as well as the schools to have some access to testing, for students. And again, going back to that health equities and trying to make sure that if we need somebody to get tested, they'll have some extra kits on hand. It hasn't rolled out yet, and so more to come. And I don't know if Dr. Urbina, if you want to speak to it any further as well with the confidence and.
Sure, I'd be happy to add to what you said already, Helene. This test is actually a very good test. If done as it's designed to be done, and hopefully there'll be some training and teaching or videos to help both staff as well as parents to do it correctly. Now, the test is clearly indicated for those who are symptomatic. It's more sensitive if you catch somebody who has symptoms within that first 7 days. So it's most accurate during that period of time. Secondly, if you have a close contact, it can be used also to identify people that are positive a little sooner with their close contact. And finally, as Rob alluded to earlier, it really is up to the district to decide how they want to use it, whether or not they want to use it as a surveillance tool to kind of measure populations on a regular basis. It could be used as well as that, because it's a fast, simple test. Those are the three indications for its use. And if used like that, it's a fairly accurate test. But it's not to be done for diagnostic tests. Still, the best test is the PCR test that we've been talking about over and over on these meetings.
And what if there's a positive result? What's the reporting requirement back from a family who gets it? Is there any way to track that, or how does that work?
That's what we have to do next, is we really have to develop those guidelines and working with all of you, teachers, principals, communities, to decide how that's reported. Because clearly a positive test means that person needs to be isolated. And the school would want to know, and we at the local health departments would want to know in Broomfield and Boulder, wherever the person resides. And then we'd have to have a discussion about quarantine and the people that are close in contact with those kids, or staff member, if the staff member is positive, how we would do that quarantine. So a lot of those protocols need to be developed, and I think that's what Helene is referring to, more to come about this.
And just to add a little bit more to that, again, to that accountability and making sure that, is it an accurate test? Is somebody reporting their test? What we've been told, we haven't seen it yet, but what we've been told is that it actually is going to be connected with a telehealth visit. And so they'll be with a health provider, when they actually do the samples. So that will help with making sure, someone does test positive, that it is reported, that, so that that feedback loop does get conveyed with everything that Dr. Urbina just shared in terms of then all the other pieces that we have to identify for quarantine, for any other exposures to be concerned with.
So the test will be administered during a telehealth? Is that what?
That's
right?
how they've described it. I haven't seen it yet in action, but the way it sounds like it'll be a telehealth appointment, and to have that access to any questions if you have them, and just to make sure that it's done correctly, and to kind of be a witness to the just the results of that swab.
Okay, that makes sense. All right, thanks.
Okay, back to Kitty.
Yeah, it's a question I forgot to ask, and I don't even know who it's for, except that we've been hearing from people who are wondering why we're not doing what Cherry Creek is doing in terms of getting tests for teachers. And Rob, I thought you said that they weren't supposed to be doing what they're doing, but I'd like clarification, and also for everybody listening.
I'm happy to address that, or at least start addressing it, and anybody else can jump in. I'd mentioned this just a little bit in that when I was talking about the vaccine slide, in that we have to follow what the state guidance is. So early on in this, when vaccines were getting pushed out, there was chaos at the beginning, and there was a lot of new information coming out. The state had worked on setting the restrictions for who's in 1A, 1B, and how we're supposed to be following those things. And what happened is Centura had reached out to the school district to ask if they wanted to have their teachers vaccinated. And as you probably heard if you watched that news clip on 9 News, they offered that to other schools as well. Well, that was actually a jumping ahead of that high priority group, which I mentioned is 78% of the deaths in the state. And that is why that got pulled back. So that was an unfortunate mishap. Cherry Creek did not go forward with that. That would have violated the provider agreement that the state's been talking about. And again, need to get through 1A, 1B, top of the line first before we can move to that level. So that was pulled back. I don't know if Chris or Helene or anybody on my team wants to add anything else to that in addition.
Jeff, if you just wanted to maybe add for the board and public, for folks who, health providers that do not comply with the guidelines, that they are at risk of losing vaccines. So, I mean, I do believe that, that we have a clear path forward. School districts and communities have a clear path forward. Health providers do right now as well. But at the beginning, certainly it was certainly there was some confusion. But I feel like we're in a good place now with that.
Yes. Yeah.
Thank you.
Okay, any other questions? Kathy?
I just want to say thanks to Rob Price and Rob and everybody, because my understanding is with our grant of to get the air purifiers, that our Swiss cheese approach to trying to keep everybody safe is probably one of the best we have on the Front Range. And I'm seeing a thumbs up from Dr. Urbina. What I'm super thrilled about for Boulder Valley is that we've done that. And I don't hear people talking about ventilation very often. And am I wrong to think that ventilation is still one of the really important key factors to helping control this until we get the vaccinations a little more rolled out?
Absolutely, I can comment on that. Thanks for the recognizing the thumbs up. I think you guys have done a great job. And I think as we learn more about the virus, and we've talked about this a lot, is that probably on the order of magnitude of protection, masks are probably number 1, physical distancing is number 2, mechanical ventilation is moving up, because we didn't see as much spread when kids were outside when there's open air. So that ventilation adds a lot. Still important to disinfect, but probably less likely to be a real potent method of transmission. But washing your hands is still very important, and social gathering is probably still up there in terms of its protection. We're all going to look back and say, we should have done more of that. But I think mechanical ventilation is in a very important role.
Okay. Other questions? Okay, I'm not seeing any, so I'd suggest we move on with the district update. Rob?
Thank you, Tina. And Randy, if you can go ahead and pull that up. I believe I am turning the presentation over to Dr. Crespo to move forward, just give you an update on some of the things that we've been doing and seeing as we've been returning back to school. So Margaret, I'll turn the floor over to you.
Great, thank you. And I think somebody else is driving, and actually I'm going to start out by handing it over to, well, that's not true. I'm gonna, Randy, can you drive for me? Good evening, everyone. While we get started, as many of you know, we are back. There is a slide that'll come up here shortly. We are back. Our elementary started last week, Tuesday, with a launch day on Monday, and then our middle schools are started today. And as Dr. Anderson mentioned, he visited some buildings today. And here are some pictures of our return to in-person learning. We're super excited that our next group coming back will be our high school group, and they start back next week. You can see happy faces. Thanks very much, Dr. Anderson. You can see happy faces of our children out there. And just want to say a huge shout out to our families and our teachers and staff for getting everything ready. We'll hear a little bit more in the next couple of slides around the amazing work that our facilities and operations teams did. And I will hand it over to Rob Price.
Margaret, thank you. Just want to highlight and start by saying to Kathy, I want really the kudos goes to Dr. Anderson. He has pushed us hard for the last month to make, as we're talking about our layered approach, making all of this a priority. So we had a big lift over the holidays, and I think this video shows it, and the next slide we'll have, or this slide shows it, and the next slide we'll highlight it with a video. But we deployed over 2,500 air purifiers, and I just want to talk a little bit about air purifiers. It's a supplemental layer to our layered approach. Masking, social distancing, washing our hands, cleaning high-touch surfaces, ventilation are all part of the approach. This is another supplemental layer to remove any particulates that we have in the air out of the air. So again, really thanks to Dr. Anderson for making this happen. Thanks to the state of Colorado for giving us the grant to allow us to have the funding to get all of these ordered. With that said, I'm going to turn it back over to Randy, if you will show the short video here.
VVSD is putting protocols in place for reintroducing students.
We're delivering air purifiers to every single school throughout the district. And I would say more than 90% of the classrooms, just to try to help out with indoor air quality and make sure all the spaces are safe for people to be in.
It's a Herculean effort, from getting awarded a grant to working with purchasing to make sure that we could expedite the order and get these air filters here on time, to our warehouse team that accepts the deliveries, and then our HVAC team who figures out the deployment plan. And then what we did is we pulled in bus drivers. We have 30 to 40 volunteers coming in on their weeks off to help us deploy these, because it's really important that we're all together for all students.
So follow him down to the library. We need 3 in the library.
They go in anywhere that there will be students, right? So the gyms, libraries, cafeterias, and then of course all the individual classrooms.
And this is one layer of our layered defense. So along with masks, social distancing, washing hands, and doing COVID screening before students come, this is one piece that will make sure that we have safe and healthy environments.
If there's anything positive to be said about COVID, and there's not much, it is that it has heightened our awareness of indoor air quality and the importance that has been there all along. All of these provisions, such as source control, ventilation, filtration, are fundamental principles within optimizing indoor air, and they are fundamental to reducing the risk of COVID transmission.
We're going to go to high and then turbo. Here at BVSD, it's really important for us to get students back into the classroom. And we really believe that putting air purifiers into each classroom, again, adds one more layer of defense against COVID.
One of the other things that we've done with the entire district basically is we're bringing in a lot more outside air to help just keep the fresh air in and the bad air out.
We've been working with districts for 30 years, but rarely does an effort such as what Boulder has engaged in typically occur.
It gives teachers, it gives parents, it gives students, it gives staff another sense of, hey, the district is doing everything possible to make sure that our environments are healthy and safe.
It definitely makes it feel safer, especially for us if they're running around the clock, even in the evenings when they're cleaning and disinfecting. It's just nice knowing that it's there, the extra precaution.
Whether it be COVID today, it's going to be something else tomorrow. This is not going away. And so it's one that we're going to have to deal with, and by situating ourselves now and better understanding the approaches that are most effective, we'll be able to allocate our resources better in the future. And I think that's very important for the district.
I just want to remind parents and staff, as well as students, that we're doing everything possible to ensure that you have a safe environment to come back to when you return to in-person learning.
Awesome. Thank you, Randy. Just a couple of things there I want to highlight. I want to highlight the work of Molly McLaughlin and Travis Cook. This was a big lift that occurred over the holidays. So thanks to both of them for organizing it. I also want to highlight the work that the board has done with the indoor air quality study and with the University of Tulsa and the University of Colorado. That has put us in a really good position to make decisions based on the data that we've collected over the last 3 years. So thanks for that work. We're still moving forward with a lot of that work, but really being in a position that a lot of districts are not in, to have that background data to understand where CO2 measurements were at, where we're at now, has really put us in a good decision. So the next slide there was COVID testing. Also over break, we set up COVID Check Colorado set up a site at Centaurus. That is a community site, so anyone that wants to be tested at Centaurus can. There is no cost to that. COVID Check also has sites in Longmont and Westminster. In addition to the Centaurus site, we also launched a mobile testing site that started yesterday. That is for staff and students. Those will be at specific schools on a daily basis. So the locations of the mobile testing kit site can be found at the link shown on this slide. They were testing at Columbine today and will be at Pioneer Elementary School tomorrow. We will have a second mobile site that will start on January 25th. And all of this testing is free for our staff and students at the mobile sites, free for the community staff and students at the Centaurus site. So what we were looking to do with these sites is we want to make it as convenient as possible for our staff and students. That's why we are having these mobile sites go to different locations on a daily basis. So with that, I'm going to turn it back over to Dr. Crespo.
Thanks very much, Rob. Appreciate all the work that everybody has done to make this launch happen. You know, as I think back, you know, we're at a year essentially of working through this, and just an incredible opportunity to see the resiliency of our community and of our staff, and constantly looking forward to how we improve our situations. Basically, it's important to mention that our current situation, as I mentioned before, is that on January 5th, our elementary students returned, and it was very successful. We're very grateful for the cooperation of our staff and community. Our middle school students returned today. It was really a great opportunity for our kids to come back. We're excited to have our high school students back, and certainly always looking forward for the opportunity for more students to come back and better attendance engagement in our building. So just want to say thank you for your patience, and we are continuing to move forward in that direction. I think something that's really important for us that we've learned through this process, you know, we constantly are planning and moving ahead and then reflecting on how to make it better. Some of you who have been following us since the beginning can see where we've tried to make these changes so that we can really meet the needs of our students. So that families are aware the content that is used in saw in Schoology is still available through those management systems. We want to make sure that our students, whether they're quarantined or not able to get to school, still have the opportunity for that in-person learning experience. And that may be through those learning management systems. It could be, as an example, through the REVA system. It may be that the student is out for just a day because they maybe didn't pass the screener. We're working on making sure that we continue with the bank of resources so that students do not miss out on those experiences in school. So just want to make sure that we revisit that. And if you have questions, certainly reach out to your teacher, your principal. Any one of us are here to help and support. Your building principals really have the most information about the largest scope of work in their schools and what their programs can do. Next slide, Randy. In our planning and our adjusting, I want a huge shout out to all of the individuals that have been involved in bringing on board our classroom monitors. As Rob Price mentioned before, thanks very much, Dr. Anderson, for launching this with us. Our HR department worked over break. We've gotten 258 applications. We had 130 people successfully hired and trained. HR broke it out, made sure that everybody had all of the training they needed in order to be in the district quickly. And we even had some deployed over the last week and a half. And we continue to have that opportunity if people are interested. We need those individuals as our teachers or groups are quarantined or a teacher is out for another reason, making sure that we have those individuals in schools to help us support our kids who are there every day. The second group that we're really excited about is our health monitors. You may remember that at one point we were talking about them as illness monitors. We recognized that name change was important. So you'll see them loaded as health monitors. We have 50 volunteers. We did an onboarding today. We had 42 individuals who are volunteering their time. And we're trained also in the important components of the confidentiality, the Google training, and anything they may need to make the calls for our families, for students that are out of school, who we may not know where they are, or we may need to just follow up and connect with them. We've essentially brought many groups together. So our attendance clerks in our buildings that really do an incredible amount of work connecting with families, and our attendance liaisons and our attendance advocates throughout the district. What we brought in is a group of volunteers that will help us process those students that may not get connected to right away, that may have situations that we need support with. And then if we do find out that those individuals that these volunteers are calling, if those students have symptoms or not feeling great or there's something going on, it's yet another layer of support. And those names get sent to our health services people who then go through the questionnaire. There's a script for the volunteer. So again, another shout out, anybody out in our community who would love to volunteer for our kids. Although we know right now that's not possible in the buildings, this is definitely a way you can help us, and just a huge shout out to the incredible work and to our volunteers as well, as we will be launching this successively over the next couple of weeks. So elementary, middle, and high in that order. And just want to say thank you again. Randy, next slide. As we look forward to our evolution of remote learning, as well as all of our learning, we're trying all the time, and certainly the teams are working hard to develop approaches to learning, both through synchronous and asynchronous schedules. We've had Dr. Sam Messier did a recent task force group with our administrators to figure out what were the best ways of learning, what are the best schedules, what systems are working, what things need support and help, and how can we do that. We certainly are working on a focus for mental health, not just in the current situation. How do we support students in different learning environments, whether it's through their clubs, activities, athletic programs, or other outreach that we can be doing with our community partners. Both of those coming together, and we will be sharing information coming soon about how we keep our students connected through this important time, as well as moving forward with our social connections. So when we think about not just the academic component, but the mental health support that is necessary, and we have a group of people that are working on that, and hope to provide more information in the coming weeks. We also, as you can imagine, we normally would be planning right now for our typical 21-22 school year. So we're investigating and researching ways that we can connect with our students. You know, one of the things that we have found through this process is that some of our students really do enjoy the entire online experience and do want to stay connected to their schools at the same time. So we will be working over the next couple of weeks to share information regarding how we keep our students online, those that are interested but still want a school connection, through a district-focused programming, so that they have the advantage of keeping connected to their schools and then at the same time being connected to their online experience, which is where they may prefer to learn. And over our time, the families that are choosing to stay online will be able to get that information launched, as well as some more updates around social interactions and mental health supports for our students for next year as well. Next slide. And Randy Barber, you're up for questions.
Just, Tina, if I can just thank the team, Rob, Margaret, everybody, board members, as you can see that our team has just worked tirelessly, many of them working throughout the winter break to make sure that we're ready to come back January 5th. We're really excited to have kids back in school. I'm really proud of the work that our team has done. I want to thank our community for stepping up in a huge way with our health monitor positions, with our classroom monitor positions, our teams that have been able to install our air purification systems. I would say that we have really put every effort possible into making sure not only that we can get back, but we continue to stay back. And so, but all of this wouldn't be possible without our partnerships with Boulder County Public Health and Broomfield Health. They have just been incredible partners, guiding us, directing us, and I'm so thankful that we have such great health partners and experts in our community to help us navigate what is just certainly an unprecedented time. So with that, I will stop, and Tina, turn it over to you for any other further questions from the board.
Great. All right, board members, raise a hand. We'll start with Kitty, then Stacy.
So I want to know, do we have enough subs, or are we still really short?
So I'm sure Mike Grados can jump in as well. We are always short. So we have a lot of subs. We really appreciate all their commitment. We cannot do this without them, but we are always recruiting subs. Kitty, would you like to join us?
I thought I read somewhere that we had all these new subs or something, so, but we still need them. Okay, that's good to know. And I'm just really glad also that we're focusing on mental health support for our kids. And I'd be interested in knowing exactly what we're doing.
Absolutely. I can take just a quick minute and share that we do have our student support services team is unbelievable. We have a long list of programs and systems and supports that we have in place, and we're constantly revisiting things like home checks, connecting with kids, reconnecting, kids that are behind in credits. Our counselors do an amazing job of reaching out to students. Families reach out to us as well. What we're working on right now is building programming for students who typically are not involved in clubs or activities, or they're in their off season, or things have changed for them, to build capacity around connecting with each other, other students, with other mental health professionals, and at the same time not overwhelming the students. Because a lot of what we hear is we need more support, we need more systems, but then when you reach out to kids, those of us who have worked with teenagers or any age kid, sometimes they're a little bit off-put by having, the adult, like, are you checking on me again? So we also want to make sure that we're not overwhelming them and then shutting them out to any re-engagement. So over the next couple of weeks, you'll definitely see what we have been doing, what we'll continue to do, and then some expansions. And actually, kids have given us a lot of insight into what they would like to see as well for them. Great question. Thank you.
So what would follow up? If you had parents who were concerned, who should they contact? I mean, concerned about their child's mental health.
Absolutely. Their first contact definitely should be to their counselor in their building, their principal or assistant principal if they're in a high school. If they don't know their counselor or they need a connection, they can certainly call the counseling office as well and get support that way. And then from there, our counselors are very, very comfortable either connecting with the student or sending them on to the other resources that we have both internally and externally throughout the district. Sometimes there are situations where they're not comfortable with the counselor. That's okay as well. All of our teachers can refer and help as well so that they can get the support systems that they need. And then I would say in the next couple of weeks, we'll definitely start to see a list around some information that we'll be providing so that it's a little bit more in your hands right away instead of having to search that out. So that's something that we will be providing shortly.
Thank you.
Oh, Tina, you're muted. I'm guessing it's my turn.
I misclicked. Sorry.
Okay. Thanks to everybody for all the great information. I have a question about wrestling, Rob. I'm glad that there was a way to work out for those kids to have a season that doesn't require them going to neighboring districts. So thanks for figuring that out. My question is about the other Season B sports and if they can expect additional guidance, such as testing recommendations or anything like that.
Yeah, I would say at this point, wrestling was the sport with the biggest concern. In working with both Dr. Urbina and Jeff, I think that if there's any other new information that may come out, we would certainly communicate that to our student athletes. At this point in time, and it looks like Dr. Urbina is on there. I'm not sure if you want to add anything additionally, but at this point in time, I think that we're good to go with all other sports. If there's any other precautions, certainly testing. We have testing available for students, and we have the ability for students to already to learn synchronously, although we're not requiring that for anybody but wrestling. But Dr. Urbina, do you want to share and add in anything else?
Dr. Anderson, I just want to make sure I only heard part of the question. I was distracted as usual. Could you repeat your question?
Yes. So the question was, would we expect any other precautions, any other plans or recommendations for other sports besides wrestling in Season B? So hockey, cheer. I know that we had some conversation about that as well. So do we see anything forthcoming, or do we feel like with the recommendations from the Metro Denver Health Partnership, we have those things covered?
I think I can try to answer that and build on what the Metro Denver Public Health Directors are saying. Is any sport that has close contact, particularly face-to-face contact, as does wrestling, would want to reduce those risks with face masks, physical distancing, all the things that we've talked about. However, those are the questions are still out there regarding cheerleading, cheer squads. Obviously, there have been questions about whether or not a athlete in a tumbling exercise can catch safely another athlete who's in a cheer squad. I think that's questions to be still answered. And then hockey, I think, is also one of those questions as well. So I think there's more to come regarding that, but I think Dr. Anderson is correct. Wrestling was the biggest question out there because that one is the most face-to-face. So more to come on that. And as we learn more, we will be sharing with Dr. Anderson and his team about how if those recommendations change.
And if I can just add to that real quick, this is Trina Rowland, attorney for Boulder County Public Health. CHASA has released pretty comprehensive guidance, and it is required that all athletes and school districts follow this guidance as part of CDPHE allowing Season B to go forward. And it's a pretty long document, so I won't go into details, but it does outline the requirements sport by sport.
Right, and basketball also is a Season B. But my question was whether there's going to be additional guidance, such as since wrestling has additional requirements, even though CHASA has already put out all of those requirements and guidance for those other sports. So thank you, I appreciate it.
Okay, other questions? Kathy?
You could, Rob, just run through, I know there have been revisions to the quarantine guidelines. So as we bring back middle and high schoolers, what is that going to look like if there's is it dependent on, I know it's going to be, is it class by class? What kind of guidance can we give our staff and our families about what happens if there's a case in the classroom at a middle or high school level?
Sure, I would maybe turn to, I'm not sure, Margaret, if you want to try to answer that, and then maybe Dr. Urbina or Jeff can kind of respond to the targeted quarantining that will be instituting.
Yeah, we
also have SOTA on here too.
Yeah, why don't we turn this over to Boulder County Public Health, Jeff, if that's okay?
Yeah, we have SOTA on the call. SOTA, do you want to take that?
My problem is I was trying to answer a phone call, so what was the question again? I'm so sorry.
The question
So
was
the question is about the contact
quarantining.
I still didn't.
Rules are around that because the quarantining is more targeted and less restrictive now. So I was just wondering if we could just get a quick overview so that people understand what those rules are.
So the targeted quarantining is dependent upon the school, the individual schools being able to make sure that students can maintain stable seating arrangements, that there's adequate social distancing between those desks or seats between the students, and we're looking at the time of exposure in case there is a positive case in the classroom, either a teacher or a student, and if masking is able to be consistent, and if the school has the wherewithal to be able to track illness in any group that has to be quarantined. So those are the things that we're looking for in order to do targeted contact identification.
Okay. Other questions?
Tina, I'm still really confused about the at-home testing. Rob, do we have a timeline for that? Is it, I didn't know about the telehealth component to it. The governor made it sound like everybody was going to have them and it was going to be this great way to help us come back to school. And of course, it's never as advertised. I'm just wondering what you know.
So we've signed up. We've gone on to the governor's the website that he designated and signed up for our employees. From what I understand, based on the call that I was on with the governor, that that there's a partnership with Amazon, and so that we'll be getting information to be able to send the at-home testing directly to our employees, and they would be getting 6 of these tests and be able to test themselves every 5 days. There was a partnership with EMR, I believe it's the telehealth component, and so when and I believe it's Abbott Labs is kind of coordinating this, and so we're still waiting on more information to the extent that we can access these for students. We still need to get more information on that. I do know that it's a screening tool. It's another tool in the tool belt to be able to, especially for those employees who want to make sure and know and understand that whether they've been exposed or not, as a tool. More to come on the ability for students to be able to access those. That would come at a cost to the district, which is something that we're okay to do. We just have to make sure to see how that fits in with all the other testing that we've been standing up. You know, we had worked with COVID Check for months to stand up not just the mobile sites, but also the site of Centaurus. And this information came out almost at the same time. So we wanted to move forward with the COVID testing. It's the PCR test, which we know is accurate and is strong. And with the Binax testing, we look to integrate that as well. But again, there's still, I think, more information to know about that. I believe that the everything was coming together late last week, according to the call with the governor. And so still waiting on more information for that. But we have signed up Boulder Valley School District to participate.
Okay. Other questions? I have a quick question about sports. Did CHASA recommend any guidelines about if an athlete or a coach knowingly knows a member of their team has COVID but participates in a tournament anyway? Is there any kind of repercussion for that?
I'm not sure who would answer that, Tina. I don't know. Well, maybe Trina would answer that because her camera just came on.
I don't think that is outlined in the CHASA guidance. It's very clear that you should not. So I would be very disappointed if someone did. But I imagine that the repercussions for that would be left up to the school district and the public health agency.
And on a follow-up, if you're in a classroom that gets quarantined at a high school and you were told to isolate for 14 days, that would also mean that you can't compete in sports, correct?
Correct.
Okay.
That is correct. Isolation is isolation. And we would discourage people that are in quarantine also from participating because they could be incubating the virus.
Okay. And then I was just curious, how many kids do we have who have chosen to go back in person, roughly, per elementary, middle, and high? Or is it still too early to know?
We can certainly provide the numbers for elementary and middle tomorrow. We would have to wait for high school just to see next week how many definitively show up. We have had a moving target definitely over the last couple of weeks, so we can get that information for you tomorrow as we get more solidified with our students returning.
Okay. And then I also had another follow-up question on the quarantining. So I think I'm like Kathy, I'm just trying to understand, like in the case of a high school, for instance, if it's discovered that a child had COVID and they've been in 3 different classrooms, because we're working on 3 90-minute blocks, and the desks will not be 6 feet apart. I think they'll be 2 to 3 feet apart, assuming there'll be 15 to 17 in a classroom. Would all 3 of those groups be isolated if that child is found to have COVID, or are you going to try to find a perimeter around the child in each of the 3 classes?
Hi, I'm Taylor Carranza with Boulder County Public Health. I can answer that as well as the school district can answer that. But for targeted contact tracing, as Soda said earlier, as long as we have a stable seating chart, and particularly that's a lot easier at the older grades, so in this case in high school, we can know exactly who was within that 6 feet for the 15-minute period. So we'd have a group that would be quarantined from each of those classes, most likely, based on that situation, of who was within 6 feet of that student. If for some reason we could not account for that student's movements, that's when you would look at a larger class quarantine, which is much more common in the lower grades, or if something were to occur in a higher grade, like a PE class or something like that, where we couldn't account for a student's movements.
Okay, and in this case, the fact that the class is 90 minutes doesn't make a difference. It's only, you're just looking for the threshold of 15 minutes.
So for the place where that comes into account is 40 minutes if we cannot account for the student's movement. So at 40 minutes, if we cannot account for a seating chart, everybody in the classroom is pulled. But if we can account for a seating chart, it's 6 feet, 15 minutes masked, or 12 feet, 15 minutes unmasked indoors. So that would be a lunchtime.
Okay, thank you. So that's all I have. Anything else come to mind? Okay, great. Rob, I think, is there another section to the superintendent's report, or is this it?
No, that would conclude the superintendent's report.
Okay. Okay, so great. That was wonderful. And then we're going to move on to our next item before we take a break, just because we have guests here that are going to present. Is that okay with everyone, board members? Okay. So we're going to move on next to our DAC. Oh, and thank you to all the public health folks who joined us. We just appreciate your time so much, and you've given us so much information. Thank you for waving. That's nice touch. So it's been, we just appreciate all of your wisdom and insight as we navigate this. So, so our next item is a presentation and recommendations by the District Accountability Committee that relate to the budget prioritization. So,
good evening.
Hello, it's Ralph and Nicole.
It's Ralph and Nicole. So I'll take the first part of this, and this is our annual submission to the Board of Education. That is a collection of, from starting with a survey that was conducted with all of the schools. We gathered the input, compile it, then report it, and I'll go ahead and share my screen, and let me make sure that you can see what I got. Are you able to see that?
Yes.
Ah, excellent. So this is going to be the first section. This is going to give you a quick readout of what the results were that came back from each of the schools. All the schools in BBSD were submitted a survey, and we focused on the importance of each theme and objective within the strategic plan. We received survey results from 41 of the schools. Here is a summary of the results. We're going to start with the highest priority as seen by the 41 schools. The blue region was identified as the most critical for that particular objective. The red area was moderately critical, and the orange area, I'm red-green colorblind, I'm hoping that's orange, was the least critical. And so on the far left side for objective number 2, the tiered system of support, it received approximately 75% respondents, identifying that as the most critical objectives within the strategic plan. Second to that was objective number 1, and the third was objective number 6 for the inclusive culture, and then fourth would be resource allocation. Now, go into a little detail. We'll take a look at these. Here was the number 1 and number 2 objectives. Number 2 objective was the highest rated, most critical. That was increasing fidelity to a tiered system of supports. The word cloud that you see on the right are the words that were most used to describe the category of importance within these objectives. The second highest objective was to increase alignment to a guaranteed and viable instructional model. So those were the first 2 highest priority objectives. The next highest priority, objective number 6, ranked 3rd in the survey. This was aligned to a common research-based framework that ensures all students and adults feel supported, respected, and safe. And again, the word cloud gives you an idea of what were the particularly acute areas within this particular response that the schools responded with. Fourth on our list of hit list parade here was objective number 3, which is ensure the allocation of resources is responsive, accountable, and focused on student growth. So here we see student outcomes, a variety of the other pieces come into play. Now, it turns out that there's a pretty solid logic that sits behind this that began to unfold. I'll put this chart up briefly so that you can see how many schools listed each objective as its first and second priority, with the orange bar showing the sum total of both. So again, as I said, objective number 2 was the highest ranked. It had the most number of objective 1 and objective 2, or highest ranking of most critical, which would have been that first priority and second priority. You can see that objective 4 and 5 were distinctly lower in the mix here. Okay, we'll move into section number 2 here, because what began to emerge as we took the data back from the schools and cross-referenced that to our ability to meet the needs of all students, a theme that aligned very closely to that response began to emerge. Here is a chart that we typically see on an annual basis from Jonathan Dings, and the message on this chart is we have, for the last 2 school years that we have data, seen the gaps widen. It's been one of the more challenging areas for the district to address, and this was front and center in theme number 1, and we found that relevant in many of the comments that we received from the schools in the survey. Here's a particularly informative chart. Sam Messier presented this chart to DAC, I believe, a year and a half ago, and it's a really good chart. So on the vertical axis, you get to see the growth. So the higher vertically a green dot appears, the higher the growth of that school. Each green dot is a school. The further to the right the green dot appears, the higher the achievement score, or the average or median scale score from CMAS for that school. What this diagram shows is that we have a significant number of schools that are in the upper right quadrant. This would be the quadrant where they are growing faster than average, and they're already in a high achieving sector when compared to their peer schools. We also have a large number of schools that are in the lower left quadrant, which is they're below average in academic scoring, and they're continuing to fall behind. Both of these trends have been prevalent in the district based on the data that we have looked at and been particularly challenging. Now we'll begin to cross-reference our academic performance to free and reduced lunch. So the chart that you're seeing here ranks each school, a blue dot, on the vertical axis with how high it ranked in the state academically, and we plot it along the horizontal axis with the percentage of free and reduced school lunch children that are in that school. And this is the as-tested demographics. So we've taken the as-tested demographics, computed the state school ranking from CMAS scores against the free and reduced lunch. And you see a near linear decline as the free and reduced lunch ratio, or the student demographic, increases in a particular school. Pretty consistent across the district. We'll now take that same information and we'll take the state ranking and we'll now compare it to the percent of white and Asian student versus academic ranking. So on the vertical axis, the higher the dot, the higher it ranked in the state. On the CMAS scoring, the more to the right, the higher the demographic is for both white and Asian students combined. What this graph shows us is that as the demographics of a school become more white and Asian focused in terms of that school's demographic, the higher the academic scoring or rank within the state. We'll now combine both of these pieces of information on what I think is a really helpful chart. So this is a three-dimensional chart. The length of the bar, the height of the bar on this chart is the ranking of that particular school. The higher the bar, the higher the academic achievement at that school or CMAS testing when compared to the 1,768 schools that were measured in the most recent tests. As we move to the front of the floor, on the bottom of this floor, we increase the ratio of free and reduced lunch students. So on the back of the floor, we have a low population of free and reduced. Front of the floor, we have a high ratio of free and reduced. And as we move from right to left, the percentage or demographics of our Asian and Caucasian students at that school diminishes. And what you see is as we move from the back right corner to the front left corner, we see a marked decline steadily across the district in school performance. So leading indicator for historically BVSD is that our school's performance will be heavily influenced by the percentage of free and reduced lunch students and the percentage of Asian and Caucasian students that are at that school. Here is another look at that data in a little different form. This is the Colorado PSAT, SAT scores. And each of the red arrows that are highlighting a particular category. So as I start from left to right, what we see is that our black students on the PSAT have been declining for 3 years straight. Hispanics have been consistently low. Free and reduced lunch is low. English language learners have been declining. And of course, students on IEPs, the story is pretty much the same there as well. Now we're going to get a really interesting look at our data. That was our data and the data collected from the state of Colorado. In the next couple of charts that I'm going to show you, the University of Stanford in California has compiled nationally academic data for all schools in the nation for school years 2009 through 2016, and it includes collectively grades 3 through 8. What we see in the chart is there's a horizontal watermark here, if you will, the national average in achievement that gives us an average for the nation. If a school, and these each of the dots, both green and blue, are a school in the nation, the higher it gets above the average, the greener the dot gets. The lower it gets below the national average, the bluer the dot. As we move to the right, we get low free and reduced lunch levels at these schools. As we move to the left, we have high free and reduced lunch levels. So what this chart is telling us is essentially two things. Across the nation, the kind of relationship that we saw with academic performance and free and reduced lunch is very typical for every single school in the nation. It's also telling us that if we strike a national median line that I've inserted in this chart here, and this national median line then normalizes the school's performance for free and reduced lunch, we see that a number of schools within the Boulder Valley School District actually fall below the median line. Here's what that means. If we take a look at school number 34 here, and the index for each of the schools is down here, what this is telling us is while this school, number 34, is performing at the national average, when compared to its peer schools that have a similar ratio of free and reduced lunch, that would be vertically, we have a lot of schools nationally that score higher when they are in this ratio. So we would say on a national average, when we account for free and reduced lunch, school number 34, 33, these schools that are below this hash line here in the median, perform below the national average when we factor for free and reduced lunch. This is the first time that we got to look at a large database. So this is big data, lots of schools, and across a fairly large portion of time. And it's essentially telling us the same information that we've been getting from Jonathan Dings and the rest of our information, but it allows us to also see that we have on school number 1 here on the far left, that's Alicia Sanchez. The good news here is there are some schools that are comparable in student demographics to Alicia Sanchez that perform quite well, and many of them above the national average. So we have room for improvement. There is the possibility that we can do more and do better. Here's that same data. So in the background, the bubbles again, these are schools. And we have the free and reduced lunch as we go left to right, but these are the middle schools. And so this allows us to look at the middle school rankings for our middle school. And because the middle schools are normalizing more of the free and reduced lunch, we don't see the same extremes. We're seeing a tighter cluster in the middle schools, but we also have this very high region on the far right-hand side of the chart where they tend to do very well. And we have other schools, middle schools, that perhaps don't have as many, or they have more free and reduced lunch students, and they're not performing at the same level. So the trend holds through middle school. Now, because the Stanford data did not provide information for us on high schools, it only went through grades 3 through 8, we went back and fetched the data for high schools, and once again, we see a ratio, a relationship that correlates free and reduced lunch to the academic performance that we would normally expect from a school. Again, these are not unique trends to Boulder Valley. These are trends across the nation. It tends to be a little more eccentric or a little more severe in BVSD, meaning as the free and reduced population increases, we see a faster drop off than the national averages, but it's still present. So now we'll take a look at the same data again. We're going to go to the dots. This is now taking a look at the white and the black student scores in the districts. So the data that we get from Stanford University is really good in this particular area because, again, it's a national database. It's across a long period of time. And it is really upfront in telling us that the racial and ethnic disparities in the academic performance have been a stubborn aspect of the American education landscape. We are by no means unique. So let me blow this up just a little bit. What this data is telling us is that Boulder Valley School District, right here with this orange dot, is performing the average for our black student academic community is slightly below the national average for the black student performance. And that for our school district, the white students, when we compare them to the black students, typically score about 2.5 grade levels above the black student population. On average, again, this is going to be on average if we were to take and aggregate all of those scores. We can now take a look at this data in a slightly different way by looking at the opportunity area, by looking at achievement gaps and gaps in affluence. So this is the same Stanford data, but represented slightly different. I'll blow this up. And what we see here is that Boulder Valley School District, again, they break this off in socioeconomic percentiles. Our students are about in what we would call in the second percentile bracket in terms of the affluence, difference in affluence. And so we can now compare ourselves to other school districts in this same category. And in this sector of affluence or free and reduced lunch percentiles, student demographics, our students perform better than average, our black student community, but again, we're about 2.5, you can see on the vertical axis here, we're about 2.5 grade levels different. But this allows us to get a much bigger picture here and a perspective of Boulder Valley School District as it compares to the nation. So the other interesting observation here is that there are districts with a greater socioeconomic difference between the white and black student communities, and they are able to, and you can see there's a greater gap in the learning. And we see the same trend that as the socioeconomic gap diminishes, so does the gap in achievement. We'll now take a look at this in what I think is a particularly important category. We're now only going to look at the 100 largest school districts in the nation. So Boulder Valley School District ranks in the top 100 for size within the U.S. Here's where we fit. The blue circles are districts, not schools, they're districts in the U.S. And this shows you the lay of the land for the districts in terms of how the socioeconomic bracket breaks out. And this also shows you where BVSD ranks in terms of the academic gap that its students achieve. So we are by no means socioeconomically the worst in terms of the largest gap. But what we can see is that there are school districts, some of them very large. The larger the circle, the larger the school district. They have a big gap, but their students are academically performing on about the same level as we have at our district. And again, we have some school districts that perform very well down here, meaning there's very little gap between a black and a white student, even though there's a socioeconomic difference in that district. So this is looking just at districts. I'll now take and compile this data here into a meaningful way. So we're going to make some sense out of the data, and I want to first define some terms so that we all are working with the same level of understanding what we mean by terms. So in this particular example, we have kids looking at a soccer game. Equality is where everyone gets the same support, and this is usually referred to as equal treatment. This is not necessarily adequate for everyone. In equity, everyone gets the support they need, and each one has an opportunity to have somewhat of equitable viewing angle of this game. Justice is served when the systemic barriers are removed from the system, okay? So I'll be using terms equality, equity, and justice in the next set of slides here. Here's equality. Equality would be that if we were to take the Stanford data, the blue and the green dots, lay them across, and if all of our schools were to lay on the national median, and we don't, we could say that we had equality because people were, our students, the people attending our schools were getting about the same level of lift, even though it's not adequate for those on the left side of the chart, but that would be equality. So we don't make the equality grade. Here's equity, and this is a place we're gonna focus on shortly. In equity, we are able to achieve a standard of academic performance across the district without regard for the variable of free and reduced lunch. So the learning opportunity, and you can see there are some, albeit a few, on the left-hand side that can get here. The encouraging part of that is that we have an opportunity to get there. Now, justice, just so we put this on the table, justice would be having the demographics of our schools all be more tightly clustered because there wasn't such a segregated socioeconomic based on the geography within the school district, but that's beyond our reach. Justice in terms of having all of our schools have roughly the same free and reduced lunch is not a place we're going to be able to get to. So here we're going to go back to that chart very briefly again about educational opportunity. Where we're looking to get to here is we're looking to get and lift the left-hand side of this chart and this area right here. These schools that we have in the upper right-hand corner, it's fair to say that we probably don't need to do anything different for those schools in the near term. Now, it's really important that we keep a concept in mind here. When we talk about disparity in educational opportunity for free and reduced lunch, and we talk about disparity based on the ethnicity of the student demographics, high Latino, high Black students, regardless of where that student sits in the district, they are going to be at a disadvantage. So it is not fair. We're not saying that the students of poverty or the students of color are not impacted over here. It's just that there are much fewer of those students located in this area than there are here. So the place to focus is here. I'm going to now turn the presentation over to Nicole, and Nicole is going to take us through the recommendations that the DAC membership came to as a way for the district to approach equity in education and to move there in a more systemic way across the district. And again, I want to emphasize here that the issues that we have are not issues with people. They are not issues with teachers. This is a systemic problem that exists across all of the educational systems in the country. So with that, Nicole, I'll turn the pages for you.
Sounds great. Thanks, Ralph. And I wanted to mention that Jorge Chavez, another member of our executive committee, is here on this call in this meeting and will help triage some questions and provide support throughout this. So just want to make sure everybody knew he was there too. So as you saw in our official memo of recommendations, and as some of the data, which new to us this year, probably you guys haven't seen a lot of that before, because there was not a lot of summative assessments, and that's primarily what the district relies on as far as data and benchmarking due to the COVID pandemic. DAC, who was always very eager for more information, found some alternative sources this year, and those were provided for you in the slides that Ralph presented. So how does this all relate to budget? At the end of the day, DAC really believes that BVSD has put together a solid strategic plan, and what we're seeing from early indicators from the UIP, that is well aligned with the strategic plan as well. And so we really want to emphasize to the board that they make funding recommendations and funding decisions that really align to the priorities that have been identified first and foremost. And that that when these funding recommendations and decisions are made, to think of them in more long-term decisions and think about the structures, how structures can be responsive to help meet the needs of the district. So overarchingly, the DEC has always recommended and continues to recommend, probably this year more than ever, is that as we're working toward the goals of the strategic plan and the UIP and improving opportunities for students across this district, it is highly important to have a higher degree of transparency and accountability at the district level and at the individual school level. We want to ensure that our strategic plans have clear improvement strategies, implementation benchmarks, similarly with our UIPs, and that those are being acted upon. We're not just talking about them at the district level, but we're really acting on them at the school level to help improve outcomes for our kiddos, our students, all across BVSD. And so I'll leave it up to the experts to decide what that exactly might look like, but feedback loops, clear conveying of the data and the metrics to stakeholders and parent groups across the district are critical in that. Also, transparency really does just improve relationships and builds trust. Nobody has to be perfect, but if we can say we're trying to get better, that goes a long way. So our largest specific recommendation is to really work on that transparency, or the culture of accountability and transparency district-wide. The second recommendations and third recommendations talk a little bit more about what we saw as priorities within the DAC survey coming out of schools, and how they align with the strategic plan, and then the data that Ralph presented to support that. So strategic theme 1, loud and clear, schools thought that needed to be highly prioritized. And DAC really agrees, standardizing scope and sequence, increasing structural alignment, using database decision-making, evidence-based practices can really help our students. Along with that, ensuring all of our students, no matter where they go to school, which school they attend, whether they are Latinx or Black or on IEP, that opportunities exist for these kiddos to do their best and to really be challenged and engaged in their learning process. This is also emphasized in from some of the work that came out of the UVA project. And I know some of those UVA schools are working on that as well. So utilizing our assets, our staff are a big asset, and really just creating a more system-wide approach on what is the good work that's being done across the district to make sure all kiddos have access and opportunity. The pandemic is creating some clear challenges in that area, and it's also creating some opportunities as well. I think some of the work that's done with the master teacher videos, there's more schools that my kiddos attend, I'm seeing a little bit more horizontal and vertical alignment, which is great. So continuing that work that has always been needed, but that the pandemic really highlighted is critical. So really targeting strategic theme 1 in that regard. And then also part of theme 1 is those tiered systems of support. As we think about, and as Margaret kind of alluded to earlier in this meeting, as we're thinking about the end of this year, next year, and I know catch-up plan isn't the best way, but part of this is really how are we going to utilize resources strategically to help ensure that that our students that are not meeting academic standards or have greater mental health needs right now, how are we supporting them strategically to make sure that they can catch up and that they're not long-term setbacks as a result of this pandemic, or where they live, or the access that they've had to different opportunities. And so that's a component of this as well, and this is something DAC has talked about a lot in the past as well, making sure all students have equitable access to more accelerated courses and challenging courses. And that looks like it might be coming, into play a little bit, or the district's working on that. But that's also an important component of this, that no matter what school you attend, the opportunities really are more equalized, and that takes a system-wide approach and some accountability from the district and the schools as well. The last recommendation that we have has to do with the Objective 6 and ensuring that all students feel safe, students and staff feel safe, respected, and supported. So, and I just realized I think I got off track with there we go, slides. And the district has done a lot of early work in this the past couple of years, I know, with the anti-bias training, some of the work around the policies and developing discipline matrices. And so continuing to build on that work, but going further to help ensure that climate and culture within the school buildings and district-wide are culturally responsive, and that we're really doing best practices to engage everybody that comes in contact with the schools, the students, the teachers and staff, parents, more authentically, so engaging them in the work ahead is the last kind of piece of that. And again, system-wide approach with high degree of transparency and accountability is where the DAC is coming to this from. That was a lot, and I recognize that, so I'm going to pause there for questions.
Great. Well, thanks for coming, and as always, thanks, DAC, not just for these recommendations, but the work that you do all year for the district. For those of you who are tuning in, the DAC is comprised of a member of SAC from each of the 56 or 7 schools that we have, and they come together and make recommendations on our policy, our budget, and other things that come up as well, and look at some of the turnaround schools. And you saw DAC present on Sanchez, I think, before we went on break. So with that, who has any questions or comments? Kitty.
So I don't have a question, but I have a comment. I was at the last DAC meeting and found out that we don't give them enough feedback as a board, and we don't let them know how much we appreciate the work they're doing as much as they would need. And, perhaps Ralph and Nicole hear more of it than the rest of the DAC membership, but I just want to say in public what I said to DAC is that I'm so thankful for the work that you do. It is an enormous job, and you are so thoughtful about it, about the work and about your recommendations, and I appreciate it, and I know everybody else does too.
Thanks, Kitty.
And to clarify there, Kitty, and we do feel endlessly appreciated. I think the clarifying point there from the DAC membership was, and I think you hear this from other parent groups across the district, the feedback loop could be improved. So when recommendations are made, how are they implemented? So we know that we're not just spinning our wheels and wasting time, and that we're an asset to the community. So it's that feedback loop, right, not only to the parent groups, but also then to the public at large. Like that is helpful.
Great, thank you. Richard.
Thanks, DAC, very much for that presentation. Wow, you put a lot of work into it.
and the feedback loop has been around for a while, and I think we need to do a better job in terms of listening to recommendations and following up on the recommendations of DAC, because you have made recommendations in the past. A couple of questions. One is that I noticed that you were using when you talked about achievement gaps and influence, you were using African American or Black student, Asian, and white student data based on the Stanford study. And I didn't hear you mention anything about the Latino or Hispanic data. Had that looked different if you'd done? Good question, Richard. The Stanford database primarily broke it down into black and white. They did not have extensive data on the Latino community. However, our data that we have showed us that we have the same student demographic disparity across our district. And in fact, it may be a bit more severe for the Latino community because it is a significantly different bicultural kind of experience. And what I would share at this point is that one of the things that has started in the district as we look at that disparity with the UVA work is that the district is actually starting, because of the UVA program, to implement some of the strategic plan in some of these schools that were, if you will, on the left-hand side of the chart. That work needs to carry through because the UVA work addresses the disparities in learning opportunities. And Richard, to answer your question now directly, if we take the Stanford data for the black and the white student, and we take the BVSD data that we have and the state data for Colorado, we see a corresponding disparity in learning opportunity.
And I would say too that if you go back in any of our data, those gaps in achievement and opportunity are clearly noted.
I clearly know that, and the other question in terms of the UVA work, it seems to me like they're doing more around staff development, professional development, and you talk a lot about opportunities that schools may present or offer to students. I don't think that the UVA data is doing that, is it? In terms of looking at opportunities that are not happening, for example, at Sanchez or Columbine? So the UVA data at Alicia Sanchez for just one specific piece where they do look at it in terms of opportunity, is they recognized a high percentage of the students' time was not in the classroom because they were being sent out. So there was there was an integral classroom setup that starts to come up with UVA, so discipline becomes less of a learning interruption, but it's integrated into the learning process. So that would be an example, and I'll let Rob talk further on that, but we saw significant change at Alicia Sanchez in terms of disciplinary interruption to learning for students. And in addition to that, you're also looking at the pull-out programs as it relates to English language learners. They're not in the classroom, they get pulled out, I believe. I'm not sure if that's true or not, but I think that's the way it works. The other question that I had was on the allocation of resources. I mean, that when you're looking at equity, equal equity, and what you term as justice, it's all based on allocation of resources, it seems like. And I also know that it's based on the CMAS and all of that in terms of the results that you get from that. But if you're looking at the allocation of resources and the way that the allocation of resources is done in Boulder Valley, and I think almost every school district, is that it's done on an equal basis, not on an equitable basis. So a couple comments on that. So Kiuli Dieng, who is Vietnamese, served on the Budget and Finance Committee when we were going through the data, made the observation, and I think it's an astute one, that if we look at the priorities, the objectives as they were laid out as priorities, the enabler of those objectives is the differentiated funding. In other words, you can't achieve those objectives as they were stated out in the absence of creating a differentiated funding. So you're absolutely correct on that, Richard. And in the case of Alicia Sanchez, we've seen that differentiated funding coming forth. So they go hand in hand. You can't do one without the other. And I think the good news here is in the detailed parts of the report is that there's a way to focus on the district can move progressively through this, and it can look at allocating resources based on need.
Yeah, because if you remove, at Alicia Sanchez, for example, if you remove the turnaround school dollars that we get, if you remove Title I school dollars that you get, if you remove all of those other dollars that you get, and you just strictly focus on the general fund, it's not equitable at all whatsoever.
Correct.
And I think that that's something that we as a board should start looking at in terms of how do you allocate equitably the general fund dollars to the schools.
Yeah, I'm going to let Rob jump in here for a minute.
Yeah.
So that is one of the strategic initiatives within our strategic plan. It was one of the initiatives that was the phase 2 initiative that we have moved to phase 3. We can give more detail when we give the strategic plan update to the board within the next month in regards to that. But certainly, the data that DAC has reviewed, we reviewed very clearly as we develop this strategic plan, which is why I think that you're seeing correlation between the data that they're looking at, the strategies and support for the strategies within the plan, especially around the instructional infrastructure, multi-tiered system of supports. You could look at research, and I've looked at this and I've lived this for a number of years. Having that high quality instructional infrastructure, having a quality curriculum, quality instructional model, and then building upon that tier 2 and tier 3 levels of supports when tier 1 instruction, which is the main instruction that students get, for whatever reason students aren't understanding, you've got to increase the intensity. I mean, those are all things that were we did a thorough review of the research as we developed the strategic plan in 2019, and so we certainly can give the board an update on that when we give our next update around strategic plan.
And I want to clear up too, just when we talked about UVA, that was around the instructional infrastructure. The opportunities that were kind of the lack of alignment is you could follow schools within the same feeder schools, and they're offering very different courses. And DAC, particularly around in the area of math, those opportunities create disparities on the road that DAC feels like should be addressed. So a little bit different.
And just as a point, a reminder to the board and to DAC that's why that's going to be one of our opportunity metrics as we start to roll out strategic plan metrics. And so lots of these things are certainly starting to come together.
Yeah, and I think that you need to look at the work that CAPL has done too in terms of what they've identified as lack of opportunities in the system. And that needs to be addressed also, because it seems to me like they've requested identified information, and they've seen opportunities that don't exist for Latino students that do exist for other students. So all of those things I think need to be talked about. And I'm not sure, and I know that you're working hard on it, Rob, and staff, but I am impatient. I think we need to move on this like as quickly as possible. We've been talking about this forever, and I'm glad, DAC, for your presentation, because it's bringing it to a real key area in terms of the work that you're doing as it relates to results and the lack of opportunity in our district where our kids that really need the opportunities.
I would give you 2 words of encouragement on that. If there's 2 things that rolled out in our survey when we got it and we ran it against the data and the systemic issues, is the strategic plan holds up very, very well. In other words, the methodology behind it is sound, and there's a great deal of alignment between our data, Stanford's data, UVA's data, the UIP. And so getting focus on it and moving, And the good news here is that this work has already started in a portion of the district. And I think so what you're saying is that we can take our success and move it forward. And I think that's in Rob's plan. At least the good news for what we saw here is that there's a high degree of correlation. We can see that it's systemic issues with infrastructure and learning opportunities. And there are already in work in the district, pieces of this, so we don't have to invent it.
Okay, other questions or comments? Lisa, then Kathy.
Thank you so much for the excellent presentation. I really appreciate the focus and clarity around the issues of justice. And I appreciate just the enormous work that went into all the different data and the different ways you've given us to look at it. So just thanks so much for bringing this and for all of the clarity you have today.
Kathy?
I echo what Lisa just said. I just have one question. When you go back to the first slide and the first priority and the transparency, I found myself wondering, is there something concrete that would be a good first step that would make you feel like that we were taking that step towards transparency? Because right now it feels a little vague to me, and that's not where you want to be when you're trying to figure out how to be transparent.
I'd say the number one comment that came up, and then I'll turn this over to Nicole, is metrics. Tell us what we're going to work on, and then let's measure it so that we all get to share in the results. I think that goes a long ways.
And transparency in how the schools specifically are going to, be impacted or implement the changes that the strategic plan is asking. So just being more clear reporting on how that's going, and as Ralph said, that using better metrics, clearer metrics, implementation benchmarks, and sharing them those more widely. And I know some districts have really great data dashboards that makes all of their work transparent. And I know that we've tried with VizLab. I don't know if that's the best or the worst among them, but making those visualization tools more available for members of our district that are engaged would also be helpful.
Okay, other comments or questions? Okay, yeah, and I wanted to make a comment. I just, and I am in my last year on the board, so I'm starting to reflect a lot on the last 8 years. But when we went through the superintendent search process, we spoke with Rob about what do you do with a place like the Boulder Valley School District, where we have schools that are in very, very different places with very different populations, and where efforts and initiatives to, and I'm going to use the word homogenize, it's not the right word, but to make the things the same are met with extraordinary resistance. And if anyone remembers, instrumental music was sort of an equity initiative that just got destroyed. And I've never gotten so many emails in my career as I did with 5th grade instrumental music. And one of the things that Rob said was his approach was going to be to get really involved where they needed the most help and to have a lighter touch on schools that didn't. So maybe a little less focus on everyone having the exact same thing, but a bigger focus on making sure that the schools that needed to rise up and create more opportunities would get intense focus. And then he quickly came up with these 6 initiatives, which I fully support, and then brought in UVA to approach this problem with a different perspective than a superintendent in my now 8 years has done. So I really do appreciate this recommendation from DAC, and that first and foremost, it validates the direction we're going, and it suggests that the UVA work and that we've already expanded to 2 more schools after we've shown that works, is going to move forward. We have our metrics are being formulated. Obviously, this was a terrible year for metrics, so it's a frustrating year if you're on DAC, and I get it, and I've been on DAC, so it's really, really hard to do 30% of the job without the materials you need, and that was pretty creative to go out and seek other data sources. But so I appreciate the idea of maintaining the momentum and accelerating to the extent that we can right now. It's an incredibly difficult time because we are currently obviously still dealing with just getting kids back in school. and now we're remediating and accelerating at the same time, which will have inherent challenges. So, but I really appreciate your work, and that's a great way to recommend how our budget will continue to be focused on these 6 initiatives. And I appreciate that your survey specifically talked about possibly waiting in between the 6. We had already taken out other initiatives, and we actually have subgroups under each of these. So, you know, we'll look at that as we look at how we do come out with our budget. So thank you so much.
Yeah, I'd make one also comment here that might be easy to overlook, and that is that one of the things that Dr. Anderson did was to break the district into smaller pieces so that, you know, when you didn't have to go so far, you didn't have to go all the way to the district. And so I want to put a plug in here for Robin Fernandez and Joel Rivera, so that when we've really needed resources, and there have been things where issues have come up, Richard, and things weren't working right, we did not have far to go to get the help that we needed. And so the organizational structure that Rob has put in allows the district to move with some flexibility. And I think that leveraging that more, giving some more autonomy to those area soups in terms of that variability. All I can speak to here is our experience at Alicia Sanchez, and it was easy to work with Robin. So I'm not saying that Rob's hard to work with, but what I am saying is that having a smaller group of schools that are a little more focused, it's a lot easier. You don't have to go running so far, okay? So there are successes here, and I think you've captured the message is we're at least headed in the right direction, and we don't have to re-engineer this, and a little more energy, a little more focus, and a little less on the pandemic. Yes, absolutely, yeah.
All right, well, thank you so much, and we look forward to the next time we all get together. I don't know when that is. I'd have to check our schedule. We've been moving things around a lot, as you know, and we actually have a budget update today, so that I do know, and we'll be talking about that if we're able to make it that far. Okay. All right. Well, thank you so much. And board members, I'm wondering, would you like to take like a 8 to 10 minute break, or should we? Oh wait, actually, we have public participation next, so I'm going to ask everyone to hold on, and we'll go to public participation. We have people who've been waiting a very long time. So let's see. Okay. So we, as you all know, many of you have been with us for a long time. We have switched to a virtual public participation for a virtual meeting. I'm hoping we're back in person soon. I'm sure we all do. And I just ask that people confine your comments to matters that are germane to the business of the school district. Limit your presentation to 2 minutes. Laura will hold up signs. You'll see a yellow card when you have 30 seconds remaining. When you have 10 seconds, you'll see the orange card. And we'll mute you at the end of 2 minutes. That's sort of a new virtual part of the public speaking, is that if you go over, it's kind of terrible, but we do mute you and give you a little leeway, of course. And that's it. So if we go to our first speaker, it is Angelia Watt, excuse me.
Hello. I came into this meeting and I was taking the stance of equity in sports with the lack of approval from wrestling. However, I would like to take a moment to thank BVSD and their work with all the parties responsible to get wrestling reinstated in Boulder County. I feel it's extremely important for every athlete to have equity in school, sports, and extracurricular activities. I'm going to ask parents to realize we cannot have our cake and eat it too. Everyone's main goal is to make sure our children are able to be successful. In the time with so much controversy, we need to embrace the community. We need to continue advocating for equality for all students, extracurriculars needs, to have contact with coaches and teachers as a means to better their physical and mental health. There is no reason with proper protocols that these things cannot happen. A coach to a student athlete is more than just a 3-month person in their lives. Coaches often know more about their athlete's struggles academically, their home lives, the issues with school life. They help the students be recruited to college to further their academic careers. We are all advocates to the same cause. Today, my topic was equality in sports, but the equity concept needs to be addressed with in-person learning, band, choir, theater, women's leadership, chess clubs, and the list can go on and on. As advocates, we need to do more and learn what most of our students have already. Listen, compromise, and work together. Thank you very much.
Okay, our next speaker is Chris Nelson, who has 4 minutes. She was given 2 minutes from Chris Goldberg.
Good evening. I have 2 teens in BVSD and also represent Boulder Valley Educational Advocates. Over 400 members in our group, including many teachers, continue to fight for equity of full-time school for all BVSD students. Excellence and equity, that is what BVSD prides itself upon, but unfortunately is not delivering to secondary students. While we acknowledge that the entire community does not share our stance, we would like to remind you that those families have been fully accommodated from the very beginning and still have the option of full-time remote learning. Our group does not speak with naivety or disregard for the good of families and businesses in our communities. We are educated on COVID-19 in schools. We know what every major scientific and reputable medical organization in the country and world recommends. We know that the governor, his working group, and CDPHE recommends. We know BVSD takes the recommendations of Boulder and Broomfield Public Health. These same county offices, which have approved full-time in-person learning for private schools and support 5-star business certifications, continue to deny secondary students the full-time public education they are entitled to. A public education that is funded by every single taxpayer in these counties. Trust me, I am beyond thrilled for local businesses. I want our community opened, but not at the expense of full-time public education. Consider that our teens can work at that 5-star approved movie theater or that back-to-business restaurant that can't be in a classroom full-time. The extra precautions schools have taken is above and beyond what many, if not all, businesses can attain. We are thankful for the steps BVSD has taken to improve ventilation in classrooms, but it should also be pointed out that many schools did their own fundraising, coordinated by their own parents and community members to raise thousands of dollars to purchase HEPA filters before the district's installations. It has been stated repeatedly, even by our own district, that schools are one of the safest places for teachers and students. We know that the in-person learning has minimal impact on community transmission, but rather than asking the community to protect our teens, our district leaders and public health officials have forced our teens to bear the burden of protecting the community. As an example of the inequity for secondary students, in the fall semester, BVSD high school students had a maximum possibility of 3 days in school, or 4% of total possible days. That translates to 96% of the time stuck on a 10-inch screen, 96% less human interaction with teachers and friends, 96% less time to ask questions face-to-face, 96% less time to have hands-on learning such as science labs. So what does BVSD do to address this? Allow failing grades to be changed to no grade and offer a supplemental program, BVSD Online, where a family can pay $300 per class to provide students an opportunity to either catch up on missing courses, improve grades, or get ahead with additional courses. What should the district be doing and providing to address this? Returning all students to school full-time immediately. At minimum, please get creative, like St. Vrain, for example, also under the jurisdiction of Boulder County Public Health, and open campuses on asynchronous days, after school hours, and on Saturdays. We are extremely grateful for the 2 days a week you have offered middle school students and will be offering high school students next week. But we ask that by February 1st, you provide a written plan with metrics to give our teams hope that they will have the choice to attend their schools full-time in person and to stop increasing the emotional, educational, and physical gaps you have already created. If you do not act to close those gaps now, our teams will indeed become casualties of this pandemic. Our teams need and deserve the choice today. Thank you.
Okay, our next speaker is Sean Howe.
Tina, I don't see Sean on the list. I think he left.
Okie doke. Then we'll move to Roger Piozak. I'm sorry about the last name.
Well, that's okay, Tina. Can you hear me?
Yes.
Okay. My name is Roger Pozak, and I would like to relate to you a conversation I had with my 9-year-old daughter, who is a Crestview Elementary student. She said, "Daddy, why do Reese and Sloan," these are our neighbor daughters, by the way, "why do they get to go to school every day, all year long?" I said, "That's because their parents moved them to a private school." Then she said, "Why are private schools open every day, all year long, and Crestview isn't?" And there, ladies and gentlemen, is the pure, brutal logic of a 9-year-old. Clearly, Boulder County Health Department and Jeff Zayak allows K through 12 in-person learning 5 days per week. Otherwise, all the private schools in Boulder County would not be able to do it. So if it isn't Boulder County Health and Jeff Zayak preventing BVSD from offering 5 days per week of in-person learning, what exactly is it? Rob Anderson, I donate the remainder of my 2 minutes time to you to answer this question and logic of a 9-year-old girl.
Okay, our next speaker is Kristen Stodden.
Sorry about that. Can you hear me?
Yes.
Okay. As second semester begins, I hope your teenage students will be more highly prioritized. For parents of secondary students, especially high school kids, who only stepped foot in their schools 3 days so far this school year, it has felt like our kids have been invisible. This is why I am a member of Boulder Valley Educational Advocates. The stories I've heard from so many parents as a result of this work have broken my heart. Your teenage BVSD students who have been kept out of their schools and communities and are at vulnerable ages for mental health struggles need so much more moving forward. I'm glad you're starting to offer 2 days a week for these kids. I hope you will be creative to move from that starting point to give them more time at school and more access to their school-related sports and activities. I hope you'll find ways to give our teens more of the sense of community they need so desperately right now. It sounds from earlier comments tonight that you are working on this now, so I'm anxious to see what comes from that for our teenage students. Along these lines, thank you for the good news for my friends in the BVSD wrestling community tonight. Lastly, I hope this goes without saying, but please do not reduce the school plan you have for our secondary students. We can't afford to rescind the 2 days you told them they'll be getting. Many of our teens are so fragile right now, if you backtrack on them again, you risk dramatically further damaging their mental health or worse. Our BVSD kids of all grades want to be able to trust again that you will put them first. Please show them that they can. Thank you. And sorry, real quick, Sean is present. If somebody can look back into letting her speak, she is still on the call. Thank you.
Yeah, we just figured that out. So we'll go back to Sean. Sean? Is Sean there?
She is, but she's muted. Sean, you need to unmute.
Okay. I'm sorry. I needed to get my. Okay. Now, can you hear me now?
Yes.
Oh, fantastic. Okay. Thank you so much. I really appreciate the opportunity to speak to let you guys know, as a constituent and a family in the Boulder Valley School District, you know, what our needs and desires are for our kids. I really appreciate some of the things that I've heard tonight. I've heard more focus on mental health and more focus on ways to get kids in secondary schools, ways to connect socially. These kids, their connection with their schools is broken, and they really need a way to get back into their community, and that is their support. I think that we can offer them counselors quite a bit, and those are very important resources, but I really think the key to these kids' mental health going forward is going to be reconnecting them to their communities in school. And as we move forward, I think we really need to be evaluating the current science. I'm sure you're all aware of the study that just came out from the American Academy of Pediatrics of an 11-district school in North Carolina. With high community transmission, they had kids in school and had very few school-acquired infections. If you haven't seen this study, I'm happy to send you a link. But I just would encourage everyone to continue reading. I know it's tiresome. I know you get a lot of studies, but these kids really need us to continue to find ways for them to get back in school more so that we can reconnect them and support their mental health. So I really appreciate the work that you're doing. I'm glad the kids are back 2 days a week. But unfortunately, I don't think the work is done. And I think we really need to push to get them back to 4 days as soon as we possibly can. Thank you so much.
Okay, our next speaker is Sarah Wise.
Hi, thank you. I'm a parent of in-person elementary school students, and I have a PhD in evolutionary biology and helped get air purifiers on our school back in October. I'm here to urge you to prepare for increased transmission within schools. The new B117 variant is 50% more transmissible. School safety studies are based on the old variant. A quote that struck me recently is, a more aggressive strain requires more aggressive mitigation just to maintain existing case rates. More aggressive mitigation could look like many ways: eliminating unmasked activity, increasing ventilation, shrinking cohorts, increasing distance, distributing more effective reusable masks like KN94s, rethinking busing, quarantining, and extracurriculars, incentivizing testing, and reducing in-person time when schools with lower mask compliance have transmission problems. It also means flexing our advocacy muscle to increase community restrictions. Vaccination is not going to save us. It's not projected to be available in for the majority of individuals in schools before summer. We can predict that risk-taking will start to increase before all individuals are vaccinated. With our current in the red case rates, COVID fatigue, and flu season, we are actually in a poor situation for dealing with B117. With natural selection, the variant will replace the original variant. Schools will be put in a position to close, as happened in the United Kingdom. This week, I encouraged individuals across our school and the district to carefully look at indoor lunch, where kids are unmasked. I received mixed responses, but thank you for yours, Margaret. Unfortunately, I was told that current practices do not need to change because our school had no cases last fall. Backwards looking will not serve us. B117 creates a new risk landscape. I was also told that sending kids with sack lunches to eat outside is an equity issue. It's definitely not a perfect solution, but it would quickly reduce the risk of all students. Also, shutting down in-person learning is much worse for equity than eating separately for a while. The best thing we can do for disadvantaged students is to keep schools open as long as possible. It would pay off to focus intensely for a few weeks on this. I also totally support all of the work that DAC has done on equity work, and if we could just focus on this for a few weeks, it would be great. Thank you. I urge you to look at all policies and resources that can be adjusted.
Okay, our next speaker is Chris Cornella.
I don't see Chris in the list.
Oh, okay. Alexander Hughes, I believe, has left.
Okay.
Is that correct?
Yeah, I don't see him either.
Okay, and then Rana Salmos.
Hi, can you hear me?
Yes.
Okay. These comments are on behalf of Colette Ventura, a Broomfield High parent. I thought I would start with a few quotes directly from our high schoolers. I don't think they understand how stressful it is. I'm learning a semester worth of curriculum in 8 weeks. It's hard. I miss my friends. I'm missing everything about being a senior. How does it make any sense that I finish my AP class in March but don't take the test until May? I don't understand why other schools 5 minutes from ours can be open full time. I'm so over it. I don't have any hope for a senior year anymore. I'm ready to move on. I'll start putting effort into school when the district starts putting effort into our education. The class of 21, along with underclassmen and middle schoolers, are painfully aware that they are being marginalized and left behind. They also know how to read graphs, charts, and even write research papers on COVID. They are aware for their age group that there is a 99% survivability rate. As a member of a Boulder Valley Education Advocates, there is one chart parents, students, and advocates would like to see. We want to see the metrics Boulder Valley is using to determine when full in-person learning will resume. The same canned answer, there are too many moving parts, is no longer acceptable. That may have worked last April, but not anymore. There is new data, new quarantine protocols, and multiple studies proving schools, including high schools, are not super spreaders. VVSD implemented new positions like the health monitor and classroom monitor to alleviate staffing issues, and most importantly, there is a vaccine. Yet VVSD has refused to clearly define and communicate what is needed to get middle school and high school students back to school full-time. VVSD teachers are known to distribute a rubric along with their assignments, which clearly identifies the components necessary for an A. So it is frustrating that a 7-person board and a superintendent with 11-person leadership team still cannot produce anything close to this after 10 months. Secondary students and their parents are entitled to know the metrics VVSD and county health departments are following to dictate when students can return to full-time. Our emails cannot continue to go unanswered, and the complete lack of transparency needs to end. Thank you.
Okay, I think that's it. And so let's do public participation, because that's when board members can have the opportunity to respond, and then we'll take a break. Does that sound good with everyone? Okay, why don't we start with Richard?
So is this board communication time?
It is board communication.
Well, number one, I want to thank all the speakers that came and spoke. And I also want to thank DAC for their great report that they made. And that's all I have.
Okay, Kathy.
I don't have much to add. I just want to thank everybody, the DAC, the parents who came forward, all the emails we're getting. It's very clear to me that our community is paying attention and cares. And I just want to assure everybody that we read everything, we consider it, and appreciate the engagement and the involvement, and to continue staying engaged as we work our way through this.
All right, Donna.
Yeah, I want to thank the parents that came forward to talk on all the issues, but especially getting our kids back in school. There's nothing more I'd like to see than the kids getting back to school and on a regular basis. Those middle school and high schoolers, they need to be in contact with each other the 4 days a week if we can possibly do it. And I stand behind you on that, and I'll continue to support trying to get them back and getting the information out to the community on how we can do this. I'm anxious to see too. I'd like to see how the vaccines are going to roll out. And I've talked to too many people today. I talked to a doctor that just kind of teary-eyed talked about, we can't afford to watch the emotional impact and toll that this has taken on our young adolescents. So thank you. It really breaks my heart to see these kids crying out for help.
Okay, Kitty? Anything?
I want to thank Donna for what you just said, because that was very well put, and I agree with you. It is heartbreaking. I don't think there's anything any of us want more than to get our students back as soon as we can. So thank you to the parents who are emailing us. Thank you to the parents who have waited. How long has it been? Over 2 hours, or almost 2 hours? No, over, to speak to us. And so thank you for that. And again, thank you to DAC for your great work. And I look forward to getting on some of those things.
All right, Lisa.
Hard to add much to what's been said, but I'll just echo those sentiments that we appreciate the ongoing engagement.
And Stacy.
Same, going last. There's really not much to add usually. So thank you for what everyone else has said and for everyone who came to the meeting tonight.
Okay, great. Do you all want to take an 8 to 10 minute break and then we'll come back? Does that sound okay? All right. See you in about, let's see, a little bit. All right, so our next item is just a FYI, we are pulling the transportation study and the equitable school day presentation just to give that a little more time to digest and to think about. So we'll bring it back in the next 2 to 4 weeks. The other information item we have is a legislative update. I don't think we have much today. We might want to skip that. Okay, so I think we can put that up, put that off. Then we'll move on to our action items, our consent grouping. Here are items. 8.1, personnel items. 8.2, approval of minutes December 8th, 2020 special meeting. 8.3, approval of minutes December 8th, 2020 regular meeting. 8.4, acceptance of donation Eisenhower Elementary. 8.5, acceptance of donation Foothill Elementary. 8.6, Alicia Sanchez Elementary UIP. 8.7, approval of a contract for mowing and landscaping services. 8.8, board acceptance of employment arbitration decision. 8.9, closeout to the construction manager general contractor contract for bond-funded work at Foothill Elementary School. 8.10, Connect Me Livewire Amendment, accelerating infrastructure construction. 8.11, Resolution 2101 regarding notice of meetings for the Board of Education. 8.12, Superintendent Rise Tutoring, Colorado Governor's Office 2020. Are there any items board members would like to pull? Okay, seeing none, could I, any questions or comments? Okie doke, and do we have a motion to accept, any motion to approve the items?
So moved.
Okay, by Kitty, seconded by Stacy. Laura, would you please call the roll?
Garcia.
Yes.
Gebhardt.
Yes.
Marquis.
Yes.
Myers.
Yes.
Sargent. Yes. Sweeney Moran.
Yes.
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 Motion passes.
Yeah, and just a quick heads up, I was looking at some other agendas a couple weeks ago, and I think there's a way to make it so we don't have to read all of these individually, which would save us even a little time. So we're going to look into that. Okay, our next item is Nederland High School 2022 CTE Pathways Fees for Chromebooks. I'm sorry, Pathways, that's my question. Who would like to kick this off?
I'd be happy to kick this off. Good evening, President Marquis, members of the board. We are presenting to you this evening some additional CTE courses to be offered at Nederland Middle Senior High School, along with some fees that go along with those courses. And you will notice at the very bottom there are some additional fees that are related to the one-to-web and one-to-CART programs. So I wanted to call your attention to those so that you're aware of those. But before you take a vote on that, I'd love to kick this to Rick Ellertson, the principal at Nederland Middle Senior, who would like to tell you just a little bit about these courses and the vision for what they're going to do for that high school.
Hello, everyone. Thanks for giving me the opportunity just to speak a little bit about what's happening up here in the mountains. I did just a couple things I wanted to share. First, we were trying to figure out a way to offer CTE to our students. It's a long drive down the mountain and back up to go to Boulder Tech. And we know that for a lot of students, those courses are life-changing. And so we pulled together community students, business leaders up here, and decided that we could come up with some pathways of our own, and started with a vision about connecting our classroom to the careers and the environment that we live. Through some research, we found that there is no career and technical education opportunities across the mountain area. And that's kind of how this whole thing was born. I wanted to, just before I jump in and share just really quickly our 5 pathways, I wanted to first, being part of this board meeting tonight has been very enlightening for me. And I wanted to make sure that the board had an opportunity to hear from one of your principals and let you know that I am incredibly grateful, having worked in 5 school districts across multiple states, 2 here in Colorado. This is the most intelligent, passionate, and caring group of leaders that I have ever worked with. And they truly put the needs of students first every single day, and I'm grateful to be a part of this team.
starting at the very top with Dr. Anderson. Dr. Crespo was the spark for this initiative. She said to me once, and I will not forget, that Nederland can be a destination school in the mountains, think towards CTE, and that's kind of the spark. Thank you to Dr. Messier and Ginny Vigilik for their unrelenting patience with all of my questions and that of my team. And Dr. Arlie Huffman as well, Jen Garfield for all of her effort in getting us organized, to the entire student, staff population here at the school and the Nederland community, and to anyone else that I forgot. This truly has been a huge team effort, and I'm really, really grateful to have been a part of it. The 5 pathways that we have are all connected intimately to the mountain area and the businesses that surround us. One of them is resource conservation and environmental science. Just a couple of pretty fun classes that are connected to that. We really focus in on engagement as well. We want to take theoretical learning, which happens in the classroom, and we want to make it more application-based outside of our school. So students who take resource conservation classes, environmental science classes, they'll be able to take Introduction to Forestry Management, Fish and Wildlife Management. They'll be able to go up to Eldora and study in the snow science program and avalanche control. They'll be able to take part in the first responder program, where they can work as part of ski patrol and EMS response, including forestry and fire service up here in the mountains. And that's through our resource conservation pathway. We also have, and I know I'm talking fast, and I apologize, I'm a little nervous. We have a computer science program here as well. Obviously, across the country and around the world, the computer sciences, students need to connect into those pathways. There's a lot of career opportunities there. A couple of programs that we are offering. We're offering cybersecurity up here, mobile app development, game design, and everything that we do in every pathway has work-based learning internships connected to it. We do have partners in every one of our pathways as we're moving this forward. We have a business and entrepreneurship pathway. Nederland, as I'm sure you're aware, is driven by small business. And it made sense after conversations with our business partners. A lot of them hire our students from our school, that some of them might one day want to own their own business, and we should provide them an opportunity to go down that route. If they do take that, we'll have leadership and entrepreneurship classes. We're opening our school store up here for the first time. The outdoor leadership pathway was hugely important to our community. Our parents in particular wanted to see more of our students engaged with our community and the environment, the beautiful place that we live. So we're offering a very healthy outdoor leadership program that includes a replacement for traditional physical education P20 programming. Our students will now take a class called Colorado 14ers. They will learn all about orienteering and route finding, all the survival skills necessary to be out in the mountains in this area. Again, a great number of career opportunities are connected to these pathways, including the Colorado Department of Wildlife, the National Forestry, and we're developing those partnerships as we speak. We're also offering an engineering and construction pathway. Trades are very important up here in the mountains, as they are, I'm sure, as you know, across the Front Range. One of the exciting courses that we're offering in addition to the others is a heavy equipment operator course, which you will not find offered anywhere else. Well, one other place, but not in the mountains ever. So yeah, kids will be able to work with our partnerships at Eldora. They'll be operating heavy equipment as part of this class. It's very exciting, and one of the things that the community actually was most excited about, not surprisingly. I would be too if I was a student. So that's what's happening up in Nederland. Very grateful for the opportunity to share that with you. I think we're going to capture the hearts and the minds of students because you know, a lot of them want these programs, and it's just a very difficult thing to access down below with the travel. So thank you so much to the leadership team at the district level who really inspired this and has supported it. It couldn't have happened without incredible effort from everybody involved. So thank you for letting me share that.
Okay. And do we have, I have a funny echo. Anyone know what it might be from? Oh, that's better. Okay. Sam, do we need to, can we open up to questions now? Is that okay? Okay, I mean, Dr. Messier, sorry. So who has, so that was, by the way, I know you said you were speaking quickly, but I have to say that the course titles and content are pretty exciting, so I understand the excitement behind the FAST speech. And I have to say, as someone who lives far from Nederland, and of course with the construction over the last 16 to 18 months, it seems further all the time. And I'm sure there are a lot of parents, if they are watching now, or they soon will be wondering how they can get their child up the mountain for some of these courses. I would imagine that will be a natural event that happens. So any questions, board members? I can see all of you if you want to just raise your hand. Richard?
Just a quick comment. Boy, those are really, really cool classes. And they really fit with the environment up there in Netherlands. I mean, that's really wonderful. I'm wondering, are these classes going to be, for example, the heavy equipment is for 11th and 12th graders? And then you have landscape construction, 9th and 12th graders. Are they going to overlap each other, or for example, those 9th graders that take the 12th graders that are in heavy equipment, are they going to be able to take landscape and construction at some point in time?
Yeah, that's the exciting thing about it. We built the pathways with the students, and that's the questions that they kept asking. And yes, they can take courses in any of the pathways that they choose. Some of the courses that we offer satisfy other graduation requirements, which was a concern. They wanted to know if they had to be either ors, and they don't. You can take courses in CTE that satisfy graduation requirements. They also lead to college pathways. So yeah, I hope that answers your question, sir.
No, that does. Thank you very much. And the other part that you answered already is that it does lead to college credit and stuff like that.
It does. I don't know how often it happens in other places, but I had 5 of my staff members taking college courses over the holiday break. They were learning about backcountry navigation and avalanche training, and they were all up in Estes Park and Rocky Mountain National Park area over the holiday break, and that doesn't happen too often. They're super invested, so it's really pretty exciting stuff.
Well, thank you so much. I really commend you and your staff and the people that worked with you on it, because I think they did an excellent job. Thank you. Thank you, Sam.
Okay. I saw Stacy's hand, did I? Nope, I did not. Kathy?
I just want to say this is so exciting and so awesome, and thank you for the excellent work. Just makes me really proud to be a member of this district, to see you guys come up with something so innovative and so student focused, and I just think it's really exciting, and I can't wait to see how it plays out. So thank you.
Okay, Lisa, I saw your hand.
Yeah, I also think this is exciting, and I feel like I have to say that sometimes it's hard to focus after 9 o'clock on presentations. So I can't thank you enough for the enthusiasm and the excitement in this presentation. I think it was infectious. So thanks for everything.
Okay. All right. Any other questions? Donna?
I just want to say, add to it all, a big thank you. I know that my own sons, had they been in Boulder Valley during this time, would have been so excited about courses like this. I have one son, after he finishes his full-time day at work, he has is a volunteer ranger up in your area up there, and often takes me on some of the hikes with him when he does his uniform thing to check the conditions. And he's done the avalanche control, the mountaineering, the orienteering, and all of these. I learned so much from him through his coursework, but he would have just jumped at the chance to have something like this available. So I'm so glad our district is innovative enough to put this out there for our young students to take advantage of. Thanks.
Okay. Rob.
Thank you, Tina. I just wanted to commend the team, commend Rick. The first week I was here as superintendent, I went up to, and Kathy was with me. We went up to Nederland and had a meeting with a concerned group of parents around what can Nederland be. Kathy, I don't know if you remember that. And this is just very, very exciting. I think that the leadership at Nederland Middle Senior High, with Dr. Messier, Dr. Crespo, Arlie Huffman and CTE, just exciting things are happening. These classes are so cool. I mean, what a really great opportunity for not only the Nederland community, but the kids that we serve up there. So just kudos to the team for bringing together the community to come up with a really great plan. Great things are happening in Ned. And so, Rick, thanks for being with us this evening. Sorry about the meeting being so long, but certainly well worth the wait.
Okay, and so I made a boo-boo. I needed to ask for a motion to approve this. So can I get a motion to approve?
So moved.
Okay, by Richard and seconded by Kitty. I think it's going to pass. So any other questions before we call the vote? All right, Laura, do you mind calling the vote on the motion to approve the fees for the Nederland pathways and also for the increase in the Chromebook fee?
Certainly. Garcia.
Yes.
Gebhardt.
Yes.
Marquis.
Yes.
Myers.
You're muted.
Yes.
Sargent. Sweeney Moran.
Yes.
This.
Yes.
Motion passes.
Okay.
Tina, can I ask a quick question about the fees?
Yes.
The new fees, I'm sure, are still subject to our policy of not charging them for free and reduced lunch families. I just want to make sure that's still the policy for the new ones.
Yeah, if you're referring to the Chromebooks, yes, absolutely. We provide Chromebooks in the One-to-Web and the Cart-to-Web program for all free and reduced lunch students.
Okay. All right. Our next item is we have two policy study items that we're familiar with. The first is policy KF and KFR that relate to the community use of school facilities.
Good evening. Thank you so much for not skipping this board item again, despite the lateness of the hour. I will be very succinct. I worked closely with Renee Williams, who has spoken to the board about her excellent work in community schools, and with Bill Sutter. Really, this is a lot of cleanup. A lot of this detail needs to be managed at the community school office level. So we are doing a nice overhaul of KF and KFR. Fun study this time. I put in a clean draft so you could see, because there were an awful lot of red lines. It's our recommendation that you streamline this and you really keep it truly at board policy level. Shorter, efficient, clean.
Okay. I'll start with one question I had, which I think relates to both this policy and the next policy. And that is, do we need to provide more guidance around when the person renting the facility or using the facility needs to provide insurance? Or is that variable based on the type of uses that is happening?
It really is something that is very well addressed in all of the documents and is something that changes based on our risk management and our insurance pool. So I would say that that's probably a level too deep for this policy, respectfully.
Fair enough. All right, other questions? Richard, and then Kitty.
Yeah, I've got a number of questions here. On the second paragraph, 6th line, where it talks about, I would like to hear more myself on how the district we will be using and applying the user fee equitably. Can you say a little bit more on that? And I guess it's probably, there's an attempt to cover that on the categories on the regulation. If that's the attempt on the regulation, then I think we need to get into some of the regulation. For example, category 1, I believe that we probably should put an additional category that would include community nonprofits that are designed to assist the school district meet its mission of educating children. And I'm thinking about some of the local community nonprofits that I'm familiar with that have as their mission to help close the achievement gap and to provide more educational opportunities. And those should be in category 1. And I don't believe that it specifies it enough on that category 1. So I would like to see that included on there. You know, we have a lot of nonprofits, communities of color that work with the immigrant parents also to improve the adult skills so that the adults can work better with their kids. So somehow maybe putting some more explanation on that category 1 would be helpful for me. And I think it would be helpful for maybe some of the community nonprofits to be able to understand that they could probably go in there at no fees being charged. And then on category 2, when we're looking at the areas of nonprofits that could maybe get a reduced fee, would we be looking at nonprofits that offer scholarships for free and reduced lunch kids as a possibility for these nonprofits to get reduced fees? Category 3, I see it as a little bit vague. I don't think there's enough information on there for, unless you can explain it to me, but I didn't see enough information on there. The same thing with category 4. We do have a lot of Latino serving nonprofits that work with adults for the purpose of assisting them, again, with skill building, etc. But these are nonprofits that may be limited in the ability to pay these high fees in category 4. I'm just pointing things out that I'm familiar with in terms of the community, in terms of nonprofits, okay. And then some examples, what would be some examples of your commercial organizations that provide youth and adult group services? That's what I have in terms of questions.
And that's helpful. I think what I would say to that, Board Member Garcia, is certainly detailing the categories in the regulation is part of the effort to have an equitable fee structure. Because part of what makes it equitable is that it's transparent, and those definitions and the fees to be charged and where there can be fee reductions is transparent to everybody, and we understand the process. Candidly, detailed discussion of those categories was not something that I really focused in on my first draft. So I would like to take your input and look at those categories again, talk with community schools, and see what improvements I can make to better achieve that objective.
Thank you, Kathleen. And did you think about talking to even some of the community nonprofits in terms of developing this new categories and policy?
So these are not new policy. They are not new categories. They are revisions to categories. So this content was buried deep in your existing policy structure. And I have had a number of conversations with some of our community partners, but not in detail about the fee structure for these policies.
Thank you.
Okay. Kitty.
Oh, I'm already unmuted. Imagine that. Yeah, one thing I noticed in there is that there can't be any alcohol or drugs or anything like that. But also I know that we can rent to churches. And I used to go to a church that met at peak to peak, and we did have communion wine. So is there a carve out for that? Or were we just breaking the law all over the place every week?
I would be extremely reluctant to tell one of my board members that they were breaking the law. I will also tell you that this is pretty cut and dried in Colorado and was something we looked at in detail when I was with the School Boards Association, because in many of the rural communities of Colorado, when they build a new school building, it's the most beautiful building for miles. And it would be wonderful to have black tie events or fundraisers. And we know a lot of adult fundraisers might raise more money with alcohol. That's a pretty hard restriction, not something I've looked at in detail, Katie, Board Member Sargent, but I certainly would, as we hopefully get to a point with this pandemic where we're actually able to allow the community to use facilities again. We'll need to look at that.
I'm only concerned about, wine used in communion, or if there is another religion that uses, a sip or two of something that, is otherwise legal.
Okay. Other questions? I just wanted to point out one other thing, which is that you can't reserve more than a year in advance. And just how we're going to communicate that. I know that one of the issues the group has had is that people expected, this is particularly true with youth sports and rentals of gymnasiums, that they kind of were locking in space. It's actually a pretty competitive process to get basketball space in Boulder, and how we can communicate that to those groups and sort of when the opening date is, and is it a first come or is it a lottery or is it a whoever calls the most? I think that from what I understand, that's actually quite a big issue.
Thank you. I appreciate that issue. I'll make sure as we go back and look at this policy and regulation again, that we really give some thought to these questions.
So, well, thank you for all your work on this, and I appreciate trying to make it clear and transparent. I don't like Renee being in a place where she has to make a lot of subjective decisions. It's very hard, I would imagine. So I hope this will help. All right. Can we move on to the next policy? Donna.
Real quick, in relative to something you said and Richard as well, I know that our HOA would often, for years, used Platt to meet at and paid the rental fee. And, we're basically a nonprofit, but we also needed to be able to reserve that a year in advance, because you can't at the last minute change what you set for years and years. So I guess it's something that Kathleen will just have to crunch into her thoughts and come up with how we do that, and it's equitable to everybody that needs that time zone. Sometimes that year we did it the next two, or we always had it. So, okay, thanks. Just a thought.
Okay, should we move on to the next one? Okay, this is the board policy KFB and KFBR, use of school facilities as child care centers.
Thank you. So this is really just a policy that relates to our larger KF umbrella. It's a particular use. This policy has been revised to address use of school facilities for child care programs and enrichment facilities. And again, it's really just intended to give direction to Renee and the people working in community schools about expectations on this particular subgroup of facility users.
Okay, questions? Any questions on the child care?
I have a concern with this particular policy. My concern is that, especially when you talk about the operation of child care and enrichment programs being the what does it say here? That the school district shall be the exclusive provider. Somehow it seems like a monopoly or something like that, you know. And I know that there's other child care providers out there that could do a good job in providing child care and enrichment programs, and it seems like this policy discriminates against these particular programs or providers, and basically that's my concern. And I don't have any word changes, suggestions, but I could look at it and think about it some more and get back with you, Kathleen. But I don't know, I'd like to get your feedback on what I just said.
Yes, I think this is a change in Boulder Valley schools. I mentioned in the board item that this is a very unusual policy. It's not one that I've seen in other school districts. It is not, in my experience, typical to have other providers operating that child care. You'll see that has a nexus to instruction. We're not talking about all programs. We're talking about those immediate before and after school. And this is an area where we see, I'm a lawyer, so forgive me, we see a fair amount of litigation in this area. We see, we have obligations to our students to make any of our before and after school programs accessible to students with disabilities in particular. As a country, we don't have a great history of building inclusive programs, and we see some of that in the before and after school care world. There's a lot of information that is shared with before and after school providers and school teams. So it is more typical to see school districts providing that care that connects to the school day and the school instructional program, doing that work directly. But again, this is a board policy, so I'm bringing to you language that is more typical, that is, and this is open for the board to determine what is appropriate for this district.
Kitty and then Donna.
So, correct me if I'm wrong, but my understanding was that part of the change of this was to address the issue of that we were pretty much subsidizing the Y in their providing child care in our facilities. Is that right?
Well, I would say that as we were relooking at these policies, which it was a good time to do it anyway, they hadn't been touched since 2014. And we've had a change in leadership, and we're really looking at making sure we've got aligned, sensible, appropriate policies. And one of the things we identified is that agreement around child care programs was a little different than what was in the board's policies. This policy, for example, has a limit that such agreements would be 2 semesters in length. We had a much longer term contract with the Y, and there were some adjustments around the rental fee with the Y. So
we've not had anyone else, have we, other than the Y, providing that before and after school care? At least recently?
Yeah, I don't think so, but I want to defer to Renee to be 100% accurate.
And
Hi, Board Member Sargent. The answer is no, it's just the YMCA.
Okay, so, I'm going to have to disagree with Richard a little bit. I don't know why we would want other groups coming in and doing it when, it's something that we know we have the capacity to do, and that we would have some uniformity, I guess, amongst all the SAC programs.
Okay, Donna?
Kathleen, did I understand you correctly, and I may not have, that you said it's unique to this district? You didn't see that other districts had this. How have other districts handled it?
They run those programs directly through something like community schools.
Okay, thank you.
Other comments? Kathy?
Well, and I think I understood you to say, Kathleen, that by running our own programs, we're able to serve all of our students, not just certain select students. So we serve the students with special needs and some of the other students that may not be served through private providers. Is that true?
Yes, that is true. And I just want to be careful when I'm saying that. I am not trying to suggest that there is active discrimination or anything else we're responding to. What I'm saying is we have watched a shift in the case law over the last 25 years. We've been working with kids with disabilities. And I think that the DAC shared equality, equity, and justice with us tonight. We are better able to remove systemic barriers when we are running those programs ourselves. And we're able to handle the work and provide really good quality programming. So what I've heard discussed is that we don't have a district need to have another provider step in to assist us in this way. And with that in mind, we provided this revised policy language.
Okay.
So just let me ask a quick question here. So then all of the students that the Y is providing a service for now would be covered by the district somehow?
Yes, it's my understanding that the district has the capacity, the capability, and the ability to provide all of the needed child care programs that have that direct connection to our instructional programming. Yes.
The before and after school programming and summer camps and all of that?
Summer camps we would treat differently. That's why I wanted to make sure that we saw that the limitation, the exclusive provider piece is that nexus to instruction. My understanding is this policy and community schools recommendation is that we continue to work with others who are providing those enrichment activities, including any summer programming. We would still have the facility use and programming opportunities with them available under the revised policies. So, for example, we'd still be looking to partner with partners like the Y, who we've got a long history with. Thorn, for example, also is a community partner, runs summer programming, and other groups who are doing really good work. Nothing about this policy would disrupt that.
Thorn also runs programs during the school year, don't they? And that wouldn't restrict them from doing that.
No, that would not. That operates under a separate MOU that the district has specifically with Thorn. So that's governed by that separate agreement.
So if a group, let's say a community group, would like something implemented that's a little bit more culturally responsive, let's say, would they be able to contact community schools and say, hey, would you offer this and as a program for?
I think they would both be able to give suggestions to existing community schools programs. that they should be more culturally responsive. That team is really is dedicated to equity, as we all are, but would also be able to propose enrichment programs and ability to deliver those through these facility use and enrichment program policies.
There would be a sliding fee scale and scholarships and all of that stuff built into it.
Yes, and a lot of that some of those programs can happen through our lifelong learning division in community schools, and then we could also see those as summer enrichment programs.
Thanks.
Any other questions or comments about this policy? Okay, do you have enough direction?
Yes, I do. Thank you very much.
Okay. All right, so we'll move on to our first study item, which is the revised budget.
Good evening. This feels like a proper hour for a budget study item. We're back on track to a late night budget item. So let me present real quick. I have a handful of slides to run through. So this is the study item for the 2020-21 revised budget. We'll cover the general operating fund and other funds. Here's a quick overview. In the general operating fund, we'll go into more detail with the changes from what was adopted back in June. Beginning balance, revenue, expenditures, transfers, reserves, then a little summary. We'll get into the other funds and discuss some of the notable changes from what was adopted back in June. I have a couple of slides on the recently passed ESSER version 2, we're calling it, the funding associated with that, and then next steps for the revised budget. So the budget was adopted with a $34 million beginning balance. When we ended the year and went through the audit process, we had $6.3 million of identified carryover. So this includes school resource allocations, textbooks, Medicaid, some department unspent budgets. Obviously, with what has been occurring in the last year, and particularly in the spring, there was a significant reduction in some of the discretionary spending that would normally happen. So that certainly led to some of those carryover items. And then overall net revenues and expenditures, we had more remaining at the end of the year than we had projected. So total beginning balance, revised beginning balance, $47.7 million. For revenue, we've made adjustments for the October count, services to charters. So we have, with our contractual agreements with our charter schools, we get revenue from them for the services we provide. And then we have some one-time revenue associated with the READ Act and abatements. The READ Act had changed its process for how it recorded, how the state wanted us to record revenues and expenses. So it was treated more like a grant. So we had deferred revenue that we received last year. So instead of a carryover item, it becomes a deferred revenue. So that's showing up here. So we have a revised budget of $340.9 million. For expenditures, $290.7 million was adopted. We have our standard carryover items here. They're noted. Again, textbooks, Medicaid, school resource allocation. Some special carryover requests. So these are either schools or departments or district-wide items that are specifically requested to be carryover of unspent dollars. Sometimes they're things that are ordered and don't get received by the end of the fiscal year, the end of the last fiscal year, or projects that are still in place and not completed. And again, same comment I made earlier, we were operating under some extreme circumstances and some activities just weren't able to happen. Then we have $7.6 million of additional expenses for one-time expenses. These are largely associated with the response to the pandemic, staffing, utilities. So as we had that nice discussion on increased air handling, that increases electricity usage, increases heating and cooling. So those are some impacts that we're seeing as a result of that. So 13.9 million additional in expenses of a one-time nature. Moving into ongoing expenditures, these all being reductions. So we received a few more dollars in the IDEA grant, so we were able to shift some of the staff that were on the general fund that we had expanded that we could use those IDEA dollars for. And then a sort of laundry list of small adjustments that total to, I believe it's just under $100,000 of ongoing expenses. So 300, the rounding in that obviously comes up to about 300,000 total. And then along with the one-time expenses, a total 304.3 million in revised expenditures. Transfers, $50 million in transfers adopted in the budget. We've reduced the transfer to the transportation fund. So obviously when we weren't running buses, the fuel expense was reduced. And then as we had staff, bus drivers, and bus assistants, bus aides working in particularly in the maintenance and custodial areas. Again, as was noted in the video earlier tonight, those expenses hit the general fund in the appropriate category of maintenance and operations. So we reduced the transfer to cover those expenses in the general fund. The charter fund, so this is a one-time transfer for a reconciliation of services last year. So there's a process that we go through. So in this, the charging for those services, if those expenses don't happen, which again, we had expenses that didn't happen last spring, then we don't charge those expenses for those services. So there's a return of funds to the charter schools for that. And then 1.5 million, this is for preschool athletics and community schools. I'll get into those a little bit later in the discussion of the other funds, the notable changes, but these are transfers to those funds for additional support. So 51 million total revised transfers. Reserves, so as we add expenditures in the general fund, we increase our reserves 3% for TABOR and 4% for our contingency. So we went from 32 to 33 million in reserves. This is just a summary that shows the change within each of those line items for the general fund with a slight change in the ending balance for about 300,000 unbudgeted ending balance. So for other funds, so the first three, the athletics fund, preschool, and community schools, I've noted these a couple of times in other presentations that these are funds that are rely heavily on fees for the services they provide. And so with not charging those fees in some instances or not being able to, particularly in community schools with the fact that we're not renting our buildings, we're not having outside activities in our buildings, or the subsidy that we've provided for all the child care activities. in this first half of this year. And then preschool fund, same thing. We did not charge tuition for the tuition side of the program while we were doing remote learning for preschool. So these are transfers to cover that loss of revenue in those funds. Charter school, the reconciliation, as I mentioned, transportation, those reduced expenditures, transportation fund. The grants fund, we have increased the line item that we include for essentially grants to be received. So we always budget an amount so that we can accept any grant revenues that might come our way. So we've increased that amount to address the new ESSER funding. I'll speak more on that later. The Para on Behalf Fund. So this is a new thing that we've had for a couple of years. This is related to the direct transfer by the legislature from the state to Para, about $225 million for all statewide participants in Para. And so we have to record in our books a transaction of a revenue and an expense for that transfer. It's our proportional share. Historically, it's the last couple of years, it's been about $5 or $6 million. That transfer was not done this year as part of the budget balancing, budget cutting process that the state went through. They did not make that transfer in the current year. So this will be a zero balance in that fund for the current year. There is a possibility that the legislature could make a adjustment in the supplemental budget process. I kind of doubt it that they would make that transfer, but if that happens and we need to do an additional appropriation later for a supplemental budget, we'll do that. But as of right now, statute is that it's a zero transfer. And then the Front Range BOCES Fund. So we have a relationship with Front Range BOCES where we handle their accounting activities. This had been handled in a revolving account, so a trust account with us where we just did the transactions for them. This is somewhat directly related to change in the accounting standards that we've discussed about the student activity funds, which are now recorded in a different way in a different fund under these new accounting standards. So similar to the Front Range BOCES, we set up a new fund just for them. It's simply just the transactional activities that we do, revenues and expenses for that program. So ESSER v 2.0. So $54.3 billion in the elementary and secondary school emergency relief fund was authorized by Congress. It is being allocated through the Title I formula to states. It comes out to $519.3 million for Colorado. The legislation authorizes the state education agency, the Department of Education, to hold back 10% of those dollars, which is $51.9 million, which I would suggest is a significant amount of money for CDE to hold back. There are some efforts underway to communicate to CDE that perhaps they should directly allocate more of those resources to school districts and not go through the granting process that they have done. They also get to take advantage of, I think that says $2.6 million of administrative fees out of that $50 million, which also seems like an excessive amount when all of that reporting activity is on the school districts to transact. So the preliminary allocation for Boulder is $6.2 million. That does include the charter schools as well. The plan is to handle it similarly to the ESSER version 1, so to speak. That was only 1.5 million, so this is certainly it's over 4 times as much in resources. The rules have not been fully published yet, or I haven't seen them yet, but they are described as being very similar to ESSER v1. So again, we'll make plans for this and have plenty of discussion about the kinds of expenses that we can use. Certainly, a lot of this is focused on trying to get schools back open. I would suggest that any opportunity we have to charge off expenses related to opening schools, like the classroom monitors, the testing, the subs, anything that is related to the pandemic, to try to access these dollars and recoup our general fund dollars that we will be able to use in a more flexible way than the federal dollars. So certainly, as we learn more about the rules behind this, we'll make appropriate plans. The legislation also extended the deadline for a year. I believe we talked about earlier the CRF funds as the Coronavirus Relief Fund. Those were the dollars allocated by the governor out to school districts, $500 million, as well as all the resources that the states and municipalities had to use, extended the deadline by a year. So it wasn't all that helpful to get that ruling like 2 days before the deadline. So it was December 30th of 2020, and it was passed on December 27th or 28th when it was signed into law. So Boulder has fully expended our allocation, the $14 million that we received. So we have put that to bed. We don't need to take advantage of this extension. And certainly some of the grant dollars that we received in December are related to the desire to get those spent out by the end of December. So I think that was beneficial to us to get some of those grant dollars for sure, and rather than sort of drag that out into the future. But it may provide opportunities for more grants if the state has dollars that haven't been spent or didn't get spent by the original December 30th, 2020 deadline. So next steps, we have a budget adoption scheduled for the meeting on the 26th. As always, adjustments can be made up through June 30th if there's additional information. And some of those adjustments could result from revenue shortfalls or unexpected expenditures, and also additional transfers to other funds as necessary. We typically have additional transfers that get made. Sometimes they're very small amounts, but they're statutorily required amounts that we might need to transfer to the preschool fund or something like that. So there's usually some cleanup, but certainly as we go through the mid-year analysis, third quarter, and get towards the end of the year, we'll know if there's additional transfers that need to be made. Or in the case of the transportation fund, for example, we may not transfer all that's been authorized if those resources aren't needed in that fund. So with that, I will stop sharing and answer any questions.
All right. Well, thank you very much. I had a quick question just to start it off. The allocation of the ESSER funds is based on a Title I allocation. Do we have any requirements in how we distribute them? Does it have to reflect a Title I, or is it just a straight per pupil regardless of the status?
So that will depend on the rules that come out that I haven't been shared yet that I know of. The original version, we had a lot of discussion about whether private schools needed to receive some of that original allocation. That is not the case in this instance. There's a separate bucket of dollars that is set aside for private schools specifically. So whether the determination in that original ESSER V1 was that you either had to handle it internally on a Title I basis or handle it as a per pupil amount to just, if you're transferring it to charter schools, for example. So there's some challenges with where we have expenditures and will need to have additional resources that don't align with Title I schools specifically. So it would be a little challenging to earmark that $6 million specifically for Title I schools.
Okay, and the Title I allocation doesn't include concentration of special education students? It's just, it ignores it entirely. Okay. And thank you for advocating for the money that the CDE has done, and let us know if you need us to pass a resolution to support that, if that's something this board wants to do.
We're working with Case right now on that. So.
Okay. Questions? Other questions? Kathy, then Richard.
So Bill, you said that, and I think maybe I just didn't understand it correctly. You took into account the October count. Did you take into account the full 2,000 or what we thought was going to be? Because we don't know what the state's going to do about the revenue for those lost students yet. So did we take the full hit, or what did we do? Did we average?
We did go into averaging. So while it would have been nice to have the legislature work on their supplemental budget, supplemental appropriation that they normally would have done soonish, and we could have built that into the budget with their month hiatus that they're going to take. It's going to push that well into February and possibly beyond. So we didn't try to hedge our bets as far as what may or may not come out of that. I know there's discussion and even been some comments made by legislators that they are supportive of keeping the current appropriation, state appropriation in K-12. They haven't said how they want to allocate that, or again, through Case, advocating for just running it through the School Finance Act so that schools that are districts that were growing would get the additional dollars for the students. And if the district is declining, go through the averaging process, but everybody gets a little bit more revenue per pupil for whatever students they have.
So we might get a little bit of a bump. We just don't know in time for you to put that into your budget for right now.
Yep.
I'm happy. I don't know what I saw, Bill, but from NSBA, I saw the draft regulations for how the money was going to be spent. I'm happy to share those with you. They had some new language in there around ventilation and improving infrastructure around Corona stuff, so I'm happy to share what I have. It may have just been draft, but that wasn't how it was presented to me. So happy to share that with you.
Oh, that'd be great.
The deadline for spending these new dollars is pretty far out too, isn't it? Like 2 years from now?
Yeah, it was a year beyond. So the ESSER V1 is September of 22, and this V2 is September of 23. So it's quite a ways out. I would suggest that if we have the opportunity to spend these resources, because it's a reimbursement type grant from CDE, so we don't need to leave the money with CDE, and not that interest rates are generating much, but we should spend those resources as quickly as possible and save our dollars.
That makes sense. And you'll be bringing us recommendations how to spend those $6 million sometime this month before the final budget, or what's your timing on that?
Oh, no, certainly we have to go through the application process, the grant process. There'll be forms and like we did with the 1.5 million, we had to tell CDE how it was going to be spent. So it'll be longer than a month, definitely.
No, and I'm just wondering where the board input is on that. When are you thinking of bringing recommendations to us to look at before you take it to CDE?
That would be a question for Rob.
Let Bill and I touch base on that, and we'll have something for you all on Friday. Do you think we can do that, Bill? Are you talking about the grant, the CDE grant, how it would come to the board for approval, Kathy? Is that what you're asking?
No, I got the $6 million that we're pretty sure we're going to get, and how are we going to be spending that? What programs, what are we doing? That's what I'm talking about. So where is the board input on how that $6 million will be spent?
Some of that guidance, the regulations on if it's expanded.
I can't hear you, Bill, sorry.
Oh, sorry. If the regulations have expanded what can be spent or what those dollars can be spent on, we'll need to study that. So I'd say a couple of day turnaround is probably a bit quick. We
have a lot of time. I was just trying to figure out what you were thinking. I mean, I figure we have time and we don't have time. We have immediate needs, but at the same time, we don't have the urgency of a deadline from the feds.
Yep.
And then, not for tonight because it's late, but at some point it would be good to have the conversation about the mill levy. And are we going to be required to increase our mill levy, or is it going to be something we have to vote on? So it'd be good if you could let us kind of keep us surprised as to where we're going to be on that mill levy.
Yep.
All right, thanks.
I like to call that the property mill levy, not the mill levy override. Just to be clear.
Correct, the total program mill levy.
Yeah, I think it gets confusing. Richard?
Yeah, I just have a question. Bill, help me understand the shortfalls that you mentioned on those notable changes.
Yep.
I think there was 3 shortfalls in there.
So it was athletics, preschool, and community schools.
And they were due to the fact that you weren't providing services, or?
So for all in the athletics fund, any sports that didn't happen, certainly we didn't have some of the expenses that went with it, but the participation fees and the gate fees are down. So that's where the shortfall is there. It's a revenue side shortfall. Then in the preschool fund, we did not charge tuition for our tuition preschool students while we were doing remote learning. And then in community schools, we're not leasing our facilities to outside vendors. The summer camps, all those things that didn't happen, that's all revenue into community schools, as well as the heavy subsidy that we did for the emergency childcare that we've been doing all year.
Thanks.
Okay. Other comments or questions? All right, that's it. Great update. Okay, so then we'll have our next update when? In 4 weeks? 2 weeks?
2 weeks. It'll come back on. I can come back on consent or regular action. Is there any?
It sounds like it could go as consent from what I'm hearing.
Sounds good.
All right. Okay, so then our last item is our permanent item, agenda setting. Anyone have something that they want to add to Rob's plate? Kidding. I shouldn't phrase it that way.
Is that a dare, Tina?
It's not a dare.
Please don't dare anyone.
I want to advocate again for dual enrollment and concurrent enrollment for our high schools.
And you've done RFIs on those, right?
Yes.
Okay. So we can put that in either an update to the board or a work session or something else, prioritization. Okay. Anything else? All right. So I'd like to adjourn this meeting. Have a good night.